Alhamdulillah dan rasa syukur terhadap Ilahi kerana pada hari ini kita telah dipertemukan para hadirin dalam seminar on Medico-Fiqh berkenaan topik yang sangat hangat dan juga masih tabu dalam masyarakat Malaysia, iaitu gender dysphoria, medical, social, psychological and Islamic perspective, atau dari segi bahasa yang lebih mudah, kecelaruan jantina dari sudut pandang perubatan, social, psychological dan Islam. Assalamualaikum dan selamat sejahtera para hadirin sekalian. Sebelum kata bersulam bicara sebelum ilmu menusuk di dada, kata orang tak kenal maka tak cinta. Oleh itu sebelum kita pergi dengan lebih jauh lagi, apa kata kita berkenalan dengan 4 orang ahli panel yang sudi meluangkan masa bersama kita pada hari ini. Okey, pada panel kita yang pertama, Assistant Prof Dr. Karunnisa binti Abu Ishaq dari Jabatan Obstetrik dan Gynecology Kuliah of Medicine IIUM. Beliau mempunyai kepakaran dalam maternity care, obstetrik dan juga seorang pakar sikit puan. Beliau akan mengupas tajuk Gender Dysphoria from Medical Perspective, Causes and Related Diseases. Panel kita yang kedua, seorang tokoh yang tidak asing lagi di IIUM, iaitu Prof Dr. Samsudin Rahman, pakar perunding perubatan keluarga dari Kuliah of Medicine IIUM. Beliau mempunyai kepakaran dalam Carcinogenesis, Family Medicine dan juga penyakit berjangkit. Panel seterusnya dibawa khas dari JAKIM, Dr. Muhammad Izzuan bin Muhammad Yusof, berlatar belakangkan mempunyai ijazah Dr. Falsafah bidang pengajian Al-Quran dan Al-Sunnah dengan tajuk tesis beliau Perspektif Komuniti Lesbian, Gay dan Transgender Muslim di Malaysia terhadap pelakuan homoseksual dan konsep perkahwinan di dalam Al-Quran. Beliau mempunyai kepakaran dalam tafsir dan isu semasa, penyelewengan tafsir dan LGBT. Okey, beliau akan mengupas gender dysphoria from Islamic perspective, khunsa dan mukhannas, iaitu hukum fiqh dan bagaimana kita berurusan dari sudut pandang Islam. Dan panel kita yang terakhir adalah Prof. Madia, Dr. Haris Shah Abdul Hamid daripada University College Mawib, Majlis Agama Islam Wilayah Persekutuan Internasional, UCMI. Beliau merupakan ketua jabatan bagi Jabatan Pendidikan Psikologi dan juga Kaunseling. Beliau akan mengupas bagi tajuk Gender Dysphoria from Psychological Perspective, kesan dan bagaimana kita mengatasinya. Baik, sedikit pesanan kepada para hadirin, Datuk Datin yang bersama kita pada hari ini. Sila letakkan mikrofon anda dalam keadaan mute. Jadi sebarang persoalan boleh diajukan di chat box atau ketika sesi soal jawab di akhir bagi setiap tajuk nanti. Okey, tanpa membuang masa, saya ingin menjemput Assistant Prof Dr. Karunnisa binti Abu Ishaq untuk mengupas kita punya tajuk yang pertama, Gender Dysphoria from Medical Perspective, Causes and Related Diseases. Dipersilakan doktor.
Okey, terima kasih Dr. Fadi. Sebentar ya. Okay. Okay, Assalamualaikum and a very good morning to all. Terima kasih Dr. Fadi for the introduction. So saya actually dari segi presentation saya ni actually mainly-nya dalam bahasa Inggeris lah, tapi saya akan campur-campur juga dengan bahasa Malaysia. So pada hari ini saya akan bercakap berkenaan gender dysphoria from medical perspective. Okay, so saya akan bercakap sedikit tentang dua case scenario, and then saya akan bercakap pasal definition, causes, management dan juga related diseases associated with gender dysphoria. So I'll go to the first case scenario. So Miss S, 29-year-old single lady with no medical illness, referred for gender dysphoria in November 2019. Her identification card status to male. Okay, she delivered full term, normal delivery. Pregnancy was uneventful, born with female external genitalia, had normal developmental milestone. Her breast and pubic hair developed at the age of 9, menarche at the age of 10. Initially, it was regular menses and become irregular, and it started to be minimal since 15-year-old. So father and mother works in business field. She's a third child from 4 siblings with 2 sisters and 1 brother, all well educated. Okay. Childhood days, she cross-gender behavior started at the age of 2. So she prefer male toys, likes to play football, prefer male friends. She feels discomfort with girls who wear male clothes, refuse to wear female clothes. So during her school years, she's not comfortable with her female friends, but she's excellent in her academic. She's a top 3 in her class. In secondary school, went to boarding school, but only able to stay for 6 months because she's not comfortable staying in the female hostel, and she feel very confused with her gender identity. She had good result in SPM. So during university years, she wear dresses and hijabs, but difficult to blend in with her female friends. But there was no disciplinary issue, and she able to complete her degree. After graduation at 25 years old, she started to dress up as a male. So start wearing pants, shirt, she grew mustache, beard, because she started to take testosterone. So she felt more comfortable with the male appearance, and she has a sexual orientation, and meaning she likes towards female. Okay, she worked as a teacher, and she has a difficulty to make her family understand about her gender identity, where they are judgmental. But she has no depressive symptoms and good coping mechanism. So on assessment, she's tall with 163 centimeter height, BMI normal. She has a masculine looking, having mustache and beard. Her breast and pubic hair development is a normal female development. Her perineum is a normal female external genitalia. So the investigation taken, all the investigation for female hormone was normal. Even the male hormone also normal, and the karyotype is 46XX. Which is female. Okay, ultrasound, there was uterus normal size and the ovaries was normal. So in this case, the issue is the history suggestive of gender identity problem. The examination shows she's anatomically, phenotypically, she's female. Investigation shows female by hormone levels and also the karyotype. And so there is no evidence of disorder of sex development from the investigation. So is this a case of transgender with gender dysphoria? So from the history, yes, yeah. Can she change her IC to male gender? Okay, so we'll discuss about gender dysphoria first. Okay, so that the definition is a psychological distress that results from an incongruence between one's sex assigned at birth and one's gender identity. So for cases of gender dysphoria, they feel unease of his assigned sex at birth, and also to the meaning there is mismatch of the gender assigned at birth and also her identity. So gender dysphoria, it is introduced in the DSM-5 in 2013, where it replaced the previous diagnosis of gender identity disorder in DSM-4. So it focused on the diagnosis of gender identity related distress rather than on the identity itself. That's why they changed it to the gender dysphoria. So the prevalence is about up till 0.014% in adult males, and 0.03% in adults female. So it's quite low. Okay, in females, the early onset form of gender dysphoria is more common rather than late onset. Okay, the rates of persistent gender dysphoria from childhood into adolescent or adulthood range up till 50%. So the presentation, usually they have a conflict in different ways. Some, it affects their behavior, they will change their dress and self-image, and then they may transition by doing sex change surgery and taking hormone treatment. So they may also want to express themselves to the public, and they want to be affirmed in their gender identity. So most case report related to gender dysphoria presented with relationship conflict in the background of depression. Okay, and they also may have personality disorder like mood lability, suicidal ideation, and for gender dysphoria, it can be presented in a case of DSD or transgender. So these are a few case report on presentation of gender dysphoria. So the patient may presented with suicidal attempt and relationship conflicts. Okay. So for the etiology, it still remains unclear, but it is thought to originate from the complex biopsychosocial problem. Okay, so the one that is well established is the biological links, which is the DSD. So I will discuss this later. So there are other causes that may cause this gender dysphoria. The other one is in utero exposure to phthalates in plastic. This can lead to an increase in the fetal testosterone level that can lead to the gender dysphoria later in childhood and adolescent. Childhood abuse also, if there is any neglect, maltreatment, and physical or sexual abuse can lead to gender dysphoria. So for psychiatric illnesses also, it can has a high prevalence to get gender dysphoria, such as in schizophrenia and in cases like autism spectrum disorder. But it is still in research. Okay, so there are genetic association that is associated with gender dysphoria, which is there are some alleles that have been found to be associated with gender dysphoria. So the various studies say that both actually biological and environmental variables play a role in leading to this gender dysphoria. Okay, so this how to diagnose this gender dysphoria. This is by DSM-5. Okay, so it is divided into children and also into adolescent and adult. So in children, gender dysphoria diagnosis involve at least 6 of the following, with an association of significant distress or impairment in function lasting at least 6 months. So the so for the case that I discussed before just now, the one that is highlighted is positive in her. So the strong desire to be of the other gender, strong preference of wearing clothes typical of the opposite gender, strong preference of cross-gender roles in make-believe play or fantasy play, a strong preference to toys, games or activities that is engaged in by the other gender, strong preference for playmates of the other gender, a strong rejection of toys, games, and activities typical of one's assigned gender. So for the case that I just discussed just now, it is meaning follow the DSM-5 criteria. So in adolescent and adult gender dysphoria diagnosis, it involves a difference between one experienced and expressed gender and significant distress. So it lasts at least 6 months and shown to be at least 2 of the following. So the highlighted one is the positive for the case I've discussed just now. Okay, so a marked incongruence between one experienced gender and also the secondary sex characteristic, a strong desire to be rid of one's primary or secondary sex characteristic, a strong desire for the primary or secondary sex characteristic of the other gender, a strong desire to be of the other gender, a strong desire to be treated as the other gender, and also a strong conviction that one has the typical feelings and reaction of the other gender. So for children, cross-gender behavior may start between the age of 2 and 4. Okay. At the same age at which most typically developing children begin, where they show gender behavior and interest. So usually during children about 2 years old, they will start to show they like in female, they will start to show, okay, suka main apa, saya suka main Barbie, or suka skirt, apa, maksudnya dia akan cenderung kepada if female, they cenderung kepada female sex at the age of 2 and 4. So for gender atypical behavior is common among young children and may be part of normal development. Okay, sometimes they may be friends with boys, but it's not persistent. So it's just for a while. Okay, so children who meet the criteria for gender dysphoria may or may not continue to experience it into adolescent and adulthood. Okay, so meaning kalau dia berubah, dia ada cenderung kepada the other gender, kadang-kadang dia akan continue. For gender dysphoria selalunya dia akan continue lah, tapi kalau just sementara, possibility of not a gender dysphoria. Okay, so for some research show that children who were more likely to become transgender adults are the one who had more intense symptoms and distress. So dia rasa tak begitu happy dengan dia punya identity. Maksudnya mak dress dia as female kan, perempuan, pakai baju skirt, pakai pink color, tapi hati memang kata, oh saya tak suka ni, saya memang suka kawan dengan lelaki, saya suka suka apa, pemakaian baju lelaki, dan dia sangat stres dan mungkin sampai dia rasa maksudnya mood pun berubah. So the other factor is the one that may become to transgender, the children who are more persistent, insistent and consistent in their cross-gender statements and behavior, and also who used to declare themselves, bila orang kata dia girl, dia kata saya bukan girl, saya boy. Okay, so these three factors may likely to become transgender adult. Okay, so this is from a research. So management of just a bit of management of gender dysphoria. So the treatment option for gender dysphoria include counseling, psychotherapy, cross-sex hormones, puberty suppression, and gender reassignment surgery. But this treatment should always be individualized. So meaning you have to really diagnose a person. So in our country, if it's transgender, actually we are more prone, meaning the management will go to psychotherapy. So usually we won't advise the patient to do cross sex hormone using puberty suppression. Okay, so it's more to counseling. But if it's a DSD, okay, which is in other words KUNSA, so we have to help them to meaning to get to the proper gender, the assigned gender. Okay. Yeah. So the goal is not to change how the person feels about his or her gender. Instead, the goal is to deal with the distress that may come with those feelings. Okay, so you have to deal with the mainly more kepada the psychotherapy. So it should involve the psychiatrist, family, physician, and also the Islamic scholar to decide on the psychotherapy, or if the patient or they want to change the IC, so you have to get multidisciplinary discussion. Okay, so to minimize this feeling of dysphoria, it can be accomplished by exploring gender identity and expression, learning ways to manage the stress, practicing self-acceptance, building a support network, making decision about transition option, and improving relationship. So I think for the case of transgender, I think Prof. Samsul will discuss more on the psychotherapy or the management part. Okay, so we'll go to the case scenario that I've discussed. So is the patient transgender with gender dysphoria? Yes. Okay, the answer is yes. because she has a gender identity, expression, or behavior that is different to the gender assigned at birth. Okay, so she feels she's not feeling a woman, and she feel there is a mismatch of the gender. Okay, so and also from the case, the investigation results show a female, the karyotype, the hormone, and there is no signs to suggest it's a DSD. So for her case, the sex reassignment is not permitted, and it can be treated by psychotherapy. So from what I've discussed just now, the DSM-5 also for the adolescent and adult gender dysphoria diagnosis, it is meaning for her case, meaning it is in the DSM-5 diagnosis. So I will discuss further on related diseases that is associated with gender dysphoria, which is the disorder of sex development, DSD. Okay, so what is the definition? It's a condition with an atypical chromosomal, gonadal, or phenotypic sex, which leads to differences in the development of clinical phenotypes. So in other words, dalam bahasa Melayu, masalah kelainan terhadap perkembangan seks dan menghadapi ketidakjelasan tentang status jantina. So in other words, kita panggil hunsa. Okay, so for DSD or hunsa, so the problem is in a normal, maksudnya untuk normal sexual differentiation, macam mana kita jadi perempuan dan lelaki, ada 3 faktor utama lah, yang perlu, which is the genetic sex, the gonadal sex, and also the phenotypic sex. Okay, so genetic sex ni sama ada dia terjadinya kromosom XY or XX. So bila XY akan terjadi testis, okay, akan adanya hormon testosteron dan akan menjadi male genital tract, maknanya lelaki. Sama juga kepada perempuan lah. So di mana-mana bahagian ni, which is genetic sex, gonadal sex or phenotypic sex yang abnormal, maksudnya ada ketidaknormalan pada mana-mana lah, so dia akan menyebabkan DSD. Okay, saya akan discuss a few lah after this. So these are the classification of DSD. So there are sex, ada tiga maknanya classification. So which is sex chromosome DSD, 46XY DSD, 46XX DSD. So dalam bahagian gynae yang biasa kami jumpa, maknanya masalah ni rare tapi yang akan datang ke gynae klinik, maksudnya bahagian sakit puan, biasanya Turner syndrome. Okay, lepas tu yang untuk 46XY DSD ni case complete gonadal dysgenesis, which is Swyer syndrome, and also another one untuk 46XY the CAIS, complete androgen insensitivity syndrome. Okay, and the other one is CAH, congenital adrenal hyperplasia, which is the 21 hydroxylase deficiency. Okay, so kenapa kes-kes datang ke bahagian gynae? Biasanya sebab untuk mendapatkan hormonal treatment lah. So saya akan cakap lebih selepas ini berkaitan dengan case DSD ni. So about clinical presentation, so kat sini kita boleh tengok, so macam for case complete androgen insensitivity syndrome, okay, 46XY, okay, the karyotype is 46XY. So biasanya case ni dia akan datang dengan primary amenorrhea yang mana tidak ada period. Okay, buah dada, breast biasanya normal, normal female, tapi pubic hair akan sikit, okay, bulu ketiak juga akan sedikit. So biasanya case CAIS ni dia akan dibesarkan sebagai perempuan lah, sebab secara luaran memang nampak macam perempuan. Okay, sebab breast normal size. Okay, So biasanya kes CAIS, dia akan even waktu dia dah besar, dia akan maintain dengan female gender identity biasanya. Okay, sebab dia tak ada, kes ni dia androgen insensitivity, maksudnya hormon lelaki tu tak sensitif. So dia tak ada kita kata tak ada hormon lelaki lah, so dia akan go towards, biasanya dia sendiri akan go towards female gender identity dan dia akan setujulah. So untuk kes complete gonadal dysgenesis, which is kita panggil Swyer syndrome, juga 46XY, so biasanya presentation dia secara luaran dia akan nampak dia akan ada buah dada yang kecil, okay, bulu pubic hair juga akan sedikit, dia akan ada delayed puberty, okay, sebab for case gonadal dysgenesis kadang-kadang dia ada uterus yang kecil, so dia presented dengan period tak ada juga. So for this case biasa dia akan dibesarkan sebagai wanita juga sebab external genitalia is perempuan. So for this case biasanya dia akan remain as female gender identity lah. So for case like PAIS, partial androgen insensitive syndrome, mixed gonadal dysgenesis, biasa presentation dia dari kelahiran. So dia akan ada ambiguous genitalia. Maksud genitalia dia ada dia ada nampak macam ada dua-dua. So for this case, biasa yang case macam ni it's a bit difficult at birth because you have to assign the gender kan, nak buat kad pengenalan semua, nak daftar kan. So for this case biasanya the family need to decide, tapi biasanya this case yang bila dia dah go towards puberty, adolescent, adult, they will have a 50-50 gender identity. Sometimes, so this case usually dia akan associated with gender dysphoria lah, sebab dia akan ada perasaan yang tak sure, okay. So dia akan, mungkin dia akan ada perlu gender reassignment later. So for 5-alpha reductase deficiency, 17-beta hydroxysteroid dehydrogenase deficiency, these two cases ni sangat rare. So sama juga, this case biasanya mungkin brought up as female, tapi later dia akan start to feel, have the gender dysphoria and they want to change to male. Okay, so semua ni disebabkan oleh kenapa adanya this gender dysphoria. All this is because of the meaning kecelaruan dalam perkembangan seks dia. Yeah. Okay, so what are the issues in management of patients with DSD? So biasanya diagnosis lah is very important. You have to get a correct diagnosis, okay? Because you need to assign the gender for this case of DSD, and then the treatment of genitoplasty, whether they need to change, maknanya daripada female ke male, maknanya for the external genitalia. So cases that require gonadectomy is cases macam Swyer syndrome, yang mana dia ada problem dengan dia punya gonad. So the risk untuk patient macam Swyer syndrome just now to get cancer, malignancy, which is gonadoblastoma, is high. It will be about 30%. So for this kind of patient, they need to remove the gonad. Okay, so it involves for the management involve multidisciplinary team. So it's not just gynae will manage them. It will involve all. So in the endocrine, the family physician, the psychiatrist, and also the Islamic scholars. So if the patient need hormonal treatment, we may give hormonal treatment. And the important management is the psychosexual issues. So for gender assignment in DSD, the primary goal in DSD is for the gender identity to be consistent with the gender assigned and to avoid a gender assignment that will increase the risk of gender dysphoria. So maksud kita kena, satu is you want to reduce the risk of gender dysphoria, and also you you have to be aware that this case of this DSD may have gender dysphoria. So when you follow up the patient, you have to always assess about this gender lah. Maksudnya kena tanya dia apa you punya sexual orientation, apa yang you suka ataupun apa yang dia prefer. So you kena maksudnya tanya lah. One of the most difficult issue in a child with DSD, especially macam saya kata tadi, ambiguous genitalia. So the assignment tu usually following the more appropriate gender, okay, and also the parents' perspective of the child's gender, okay. So that will be the gender of rearing lah. So the influence factor for sex assignment include the diagnosis, okay, the genital appearance. So which one is more? Macam is it the male or is it a female? And then the fertility potential later. Also, is there any therapeutic or surgical option? And also the family views and the circumstances, including the cultural biases. So it's important, meaning it really needs a discussion on the gender assignment in DSD. So a small minority of DSD may feel the need to change gender in life. Thus, the assigned gender may be changed because kalau kita kata khunsa ni, selagi dia tak decide on dia punya one gender, maksud dia still dikatakan khunsa lah. So tapi bila dia dah decide that gender, one gender ni, then you cannot change anymore. So saya rasa later Ustaz akan discuss further on khunsa. So in many cases, childhood gender dysphoria does not persist through adulthood because the gender identity is still fluctuating in the development phase. Okay, so it is essential to address a possible comorbid psychiatric disorder in cases of DSD. Okay, and also we need to address the sexual and fertility potential with the patient, and also it requires psychosocial and medical assessment. Okay, so I'll just discuss a bit another case on gender dysphoria. So this is Misty, a 21-year-old girl, expressed the desire for gender reassignment. She delivered normal, okay, normal developmental milestone, raised as a normal female. So early childhood, tomboyish, comfortable playing with boys, and also watching wrestling, wearing t-shirt and skirts, plus jeans, okay. At 18 years old onwards, she dressed as a male, changed name to Mr. T. So stop removing facial hairs, feels more comfortable in male gender role. And also she works as a salesman. So from adolescent, she start to gain weight, develop hirsutism, require frequent facial hair removal. So the frequent hair removal ni dia feel a bit distressed because she has to do it frequently. Okay, she doesn't have menarche. She attract to female. Okay, and she dislike to be called as a female. So on examination, her height is 160. Breast and pubic hair is 10/5, which is a normal female. The external body habitus was male because of the facial hair. Yeah. External genitalia was a female with a clitoromegaly, maknanya the kelentik besar sedikit, about 2 cm. So investigation wise, karyotype is 46XX, ultrasound normal uterus and ovary seen. The hormonal profile for female is normal, but there is low cortisol, 17-hydroxyprogesterone, and DHEAS was high. This is the androgen hormone. Yeah, the dexamethasone suppression test shows complete suppression. So this is suggesting of a non-classical congenital adrenal hyperplasia. So CAH is part of DSD. So this patient is a khunsa. Okay, so the issue for this patient, although she has a gender dysphoria, but from investigation it shows CAH. Yeah. So for this patient, can she reassign to male gender? So so for her case, I think it needs a discussion with all the multidisciplinary expert, as what I've mentioned before. Okay, all right. Okay, so just a bit on the challenges for gender dysphoria. So it is associated with high level of stigmatization, discrimination, and contributing to negative self-image, and also increased rates of other mental disorder. So adolescent and adult with gender dysphoria are at risk of suicidal attempt, and also the preoccupation with cross-gender issue that can interfere with daily activities, cause problem in relationship or in functioning at school or work. So children with gender dysphoria may experience teasing, harassment at school, and higher risk of emotional and behavioral problem, also anxiety and depression. So in conclusion, gender dysphoria is a mental disorder, distress that occur in DSD or transgender. So, so for cases of DSD, it should be for that kind of case, it should be managed multidisciplinary team. I mean, it should be involve endocrinologists, family physician, gynecologist, psychiatrists, Islamic scholars, because they may need a reassignment of gender. Okay. But for transgender, yes, it also need multidisciplinary team discussion, but the main treatment is more to psychotherapy. So proper investigation is needed to avoid missing important diagnosis for the correct treatment. And psychotherapy is an important management in gender dysphoria. Okay, with that, thank you.
Alhamdulillah, Masya Allah. Terima kasih kepada Jazakumullah Khair kepada Dr. Khairunisa atas slide tadi. Ijaz, ada satu soalan, boleh Doktor? Saya rasa soalan ni bermain di para fikiran para hadirin lah. Sebab Doktor sebut tadi, antara benda yang kita perlu lihat adalah differential diagnosis, which is DSD. So ada soalan daripada USM kat sini, untuk for child of case of ambiguous genitalia, when is the suitable time to be operated for changing of genitalia? Maksudnya seawal umur berapa kita boleh decide untuk untuk pertukaran jantina punya, bukan pertukaran lah, maksudnya reassignment surgery, gender surgery untuk pesakit tersebut.
Okay. Selalunya untuk ambiguous genitalia memang it's a dilema lah sedikit, sebab kita tak sure dan kita tak nampak lagi the child prone to which gender kan. Biasanya the sex reassignment ni biasa kita suggest actually at a later age sebenarnya. Sebab kita takut dia akan berubah bila biasanya the sense of perasaan dia tu akan start during that maksudnya yang paling tinggi is around macam saya kata tadi lah, biasanya you akan nampak around 2 to 4 years old yang dia akan ada prone to mana kan. Tapi yang paling ni ialah during puberty lah. So saya tak boleh nak kata bila exact, tapi actually it involve discussion with all the teams. Tapi to me it should be at later, not during that birth lah. Bukan waktu birth dah buat, dia perlu, makna later you have to see the child prone to which gender. Harap dapat menjawab Dr. Fadi.
Kalau dari pengalaman doktor sendiri, paling muda yang pernah doktor experience?
Sebenarnya untuk saya, sebab saya sebelum ni saya belajar, maksudnya my subspecialty is in Peds Adolescent Gynecology. So saya berada di UKM lah. So dari segi maksudnya from my experience, sebab tak banyak lagi case Dr. Fadi yang saya handle for cases like the ambiguous genitalia ni, sebab it's quite rare kan. So di UKM last time ada beberapa case tu actually saya tak sempat sampai they go into surgery lah, Dr. Fadi. So biasanya even during the at birth, maksudnya jumpa tu banyak at birth. So at birth tu biasa they will delay it. Maksudnya they will assess setiap kali follow up tu dia akan tengok okay 2 years old, 4 years old. Tapi setakat yang saya punya pengalaman, actually saya tak pernah ada experience in the surgery part.
Okay.
Sebenarnya.
Baik. Okey, doktor. Untuk para hadirin ada soalan yang boleh dikemukakan sama ada di chat box ataupun boleh buka mikrofon untuk tanya. Kita buka.
Di chat box nanti Dr. Fadi saya boleh type lah. Saya boleh jawab dalam chat box juga.
Okay, baik. Alright, kalau tak ada soalan, saya ada soalan untuk doktor. Berkenaan macam tadi doktor ada cakap di awal presentation yang untuk golongan yang mempunyai gender dysphoria, mereka mempunyai tendensi untuk mempunyai suicidal ideation. Is it common untuk kita tanya the gender identity background untuk setiap kes yang mempunyai suicidal ideation untuk mencarilah orang kata salah satu penyebab kepada keadaan tersebut?
Saya rasa Dr. Fadi dia tengok juga background history kan. Maksudnya kalau kita berjumpa dengan pesakit yang ada suicidal ideation ni, sometimes you have to see. Yalah, maksudnya dia punya penampilan pun kita dah boleh tengok kan. So if penampilan tu nampak macam contohnya kita tahu she looks a bit tomboyish kan. Perempuan yang nampak macam lelaki sedikit. Then maybe the question of this gender identity ni, gender dysphoria ni, you can ask the patient. Maksud it depends on cases lah. Kalau you think it is associated with maybe this patient has gender dysphoria, then you ask about the gender identity.
Okey, terima kasih doktor. Ada soalan anonymous. Di awal presentation tadi pun doktor ada sebut antara faktor yang boleh menyebabkan sebab kita tak ada faktor yang jelas basically untuk pesakit mempunyai gender dysphoria dari sudut pandang medikal. Berkenaan dengan fetalitas plastik. Boleh kalau doktor sebut cerita sikit dia punya apakah itu fetalitas in plastik? Kalau doktor boleh.
Okay.
Sebab yelah ada ibu-ibu yang agak concern berkenaan waktu mengandung ni.
Sebab dia research yang mengatakan plastik, maksudnya phthalates tu kan.
Betul, phthalates.
Phthalates in plastik. Maksudnya dia boleh menyebabkan increase testosterone. Tapi maksudnya bukanlah dalam kita punya normal daily yang mana kita memang ada menggunakan plastik. Tapi plastik, sebab penggunaan plastik kita ni kebanyakan kan sekarang dah BPHA yang maksudnya a good plastic product lah. So saya sebenarnya tak begitu pasti regarding how the research was done, but it's not I think the normal in our daily plastic usage lah. So saya rasa tak perlu risau kepada ibu-ibu mengandung, sebab kita sekarang maksudnya even penggunaan plastik untuk kita pun sekarang dikurangkan kan? Betul.
Okey, terima kasih banyak doktor. Ada soalan lagi di chat box tapi saya rasa because kita mungkin perlu ke sesi seterusnya. Mungkin nanti Dr. Karunisha boleh jawab di chat box. Okay. Baik, terima kasih banyak. Jazakumullah khair kepada Dr. Karunisha atas kupasan tajuk gender dysphoria from medical perspective, causes and also related diseases. Baik, tanpa membuang masa, kita menjemput panel kita yang seterusnya, Prof. Dr. Samsul Rahman untuk mengupas tajuk gender dysphoria from social perspective, effect of the gender dysphoria from the social problem. tanpa membuang masa, saya menjemput kepada Masykurah, Prof.
Assalamualaikum warahmatullahi wabarakatuh. Thank you, Dr. Moderator. Nampak ke slide ni?
Nampak, Doktor?
Nampak? Okay.
Boleh.
Thank you to the organizing committee, lecturers, doctors, brothers and sisters, ladies and gentlemen. It's a great pleasure to present this topic. And I'm not basically to teach you all, just to share my detailed experience on gender dysphoria from social perspective, basically focus on sexual desire. So if we go to Al-Quran, Surah 27, verse 54 to 56, Allah mentioned, do you indeed approach men with desire instead of women? Rather, you are a people behaving ignorantly. So the issue of gender dysphoria ni, dia basically because of desire. It is, kalau you, based on the Diagnostic DSM mentioned by the first speaker, they quote the strong desire. So there is the keyword, the desire. So the treatment must focus on desire. You cannot give a tablet to settle the desire. And these people behaving ignorantly. So those yang involved ni, Al-Quran label as ignorant. In other words, kalau in Malay word kita kata kurang cerdik lah, kurang pandai. So to make it simple analogy, kalau this one a tree, so desire to basically below soil level. What happened today, we just focus above the soil level. So that means kita focus on treatment, HIV, hepatitis B, hepatitis C, and all other sexual transmitted disease. So they want above sea level. Tapi the roots of the problem, basically the desire. That means if you want to treat gender dysphoria, you must cover both sides, above sea level as well as below sea level, below soil level. Okay. So because of we overlook the soil level, below the soil level, that's why USA, gay and bisexual men community remain most affected. Because USA, they just focus on HIV. They forget the root of the problem, the desire. And Philippines registered the fastest growing HIV/AIDS epidemic in the Asia Pacific. This data 2017. So public dia buat demonstration, LGBT buat kissing and hugging in public. So can you see the magnitude of the problems? So kalau Philippines 2015 in February 646 cases, and out of this 96% were male. So majority of LGBT ni, majority those affected HIV ni were male in Philippines. And Singapore itself will decriminalize sex between men, effectively making it legal to be homosexual in the city states. Even Qatar, you know, the host for our recent World Cup, if you want to express your views on the LGBT cause, do so in a society where it will be accepted. Do not come and insult the entire society. So Qatar, they're very firm and they're very serious against LGBT issue. So about Malaysia, so kita Malaysia basically we are very firm on this matter. That's why same-sex sexual activity is punishable up to 20 years but rarely enforced. So kita ni terkepit between Thailand and Singapore. So despite kita ada our own regulation and rules, but the issue of HIV is still dominant. As you can see here, the proportion of sexual transmission has increased to more than 90% in 2016. So this one, 2016, and homosexual groups are more dominant compared to heterosexual. Heterosexual maybe just 40%, tapi homosexual more than 50%. This one 2019. And the age group 20 to 29 years old. This one young generation, our student age ni, IPTA ni, 45%. And 30 to 39 years old, 30%. So both groups ni dah 75%. So it's a great loss to Malaysia actually. And then 2021 again, the pattern tu sama je. Pattern is still male to male sex are dominant compared to the rest key populations. Okay. So to make it easier, you can see here 2021 homosexual yang the blue color, and the age group 20 up to 40, so 77%. So kalau kita go for future study 2030, so 2030 still MSM group, men, sex men. That's why, brother and sister, we need to review back our management. Is it physical management is more than enough? Maybe we need to review, we need to attach with the spiritual therapy. If we expect different result, tapi kita use the same method, for sure, we won't get it. And groups condemn UKM lecturer discriminatory remarks on LGBTQ community at MOH World AIDS Day event. So this Ustaz from UKM, the groups comment that made disparaging and hurtful remarks toward people living with HIV, LGBTQ community. And this Ustaz basically they mention simple je, bertaubat. And he claimed that being LGBT is a root cause of HIV infection. So this group, MSC, Malaysian Aid Council, dia kata they urge media, government and community to respond with a right-based, evidence-based approach that avoids stigma and discrimination. And they also urge the organizer, MOH, to include MSC in the screening and vetting of the speaker for future event. So from this statement, as if this Ustaz ni, kalau you say something yang betul, actually this is wrong. Ni dah akhir zaman, kalau kita mention something yang betul ni, dia jadi salah, dia jadi terbalik pula. So why don't we check this Ustaz statement, betul ke dia salah Ustaz ni? So kalau kita tengok from anti-retroviral therapy 2017 CPG, receptive anal intercourse 138 rate of HIV acquisition per 10,000 exposure. This one yang homosexual community. Whereas yang those yang heterosexual, penile vaginal intercourse, just 8 compared to 138. Okay, and then what is the risk of HIV from anal sex? 18 times greater than vaginal intercourse. And why? How do you explain this? Because rectal mucosa, dia ada just single layer of columnar epithelium compared to vaginal mucosa, dia ada stratified layer, stratified squamous. So stratified squamous ni dia very thick, very elastic. And dia boleh, apa orang kata, cope with, apa orang kata, pressure ke, whatever friction dia. Compared to rectal mucosa, columnar, which is very thin, easily broken, easily torn. And that's why kalau practice anal sex, that's why they got apa orang kata HIV infection easily. And even from this study, 2013, transgender mempunyai risiko sebanyak almost 50 times compared to general population in getting HIV. So what the Ustaz mentioned itu actually betul. Based on research, based on evidence, nothing wrong. That's why kita confused why MSC kata salah. Okay. And then we have spent a lot. Malaysian government spent 60 million in 2019 and 70% goes to treatment, care and support. And 2020 kita spend 85 million and 76.4% just focus on treatment. 2021, 82 million, then 62 million to just focus, just went to treatment. That's why kita need to review back our management. Betul ke just physical je? Adakah physical yang the best? Maybe we need to attach, combine physical and spiritual. And recently, PrEP untuk pengamal homosexual. Recently, MOH, Ministry of Health or KKM, to make HIV prevention drug available for free. And this one will be dispensed at public health clinic in Selangor, Klang Valley, Johor, Penang and Sabah. And PrEP available at no cost at several public health clinic, basically klinik kesihatan, scaling up the use of medicine to estimated 19 to 10,000 key population members. And the program is run under Malaysian AIDS Council in collaboration with the MOH and is funded by the Global Fund. And this program will be 2-year free PrEP program. And basically the on-demand PrEP can only be offered to men, but not women. So kalau women, they still have to take their PrEP. So the issue now, brother and sister, for zero-discordant couple, okay, acceptable. We understand because maybe the husband to positive HIV, but the wife to negative. That's why we call the zero-discordant. So that one acceptable. Tapi yang kita query, yang we prefer this method to be reviewed yang homosexual. Those yang homosexual, those yang HIV negative. Ni kita minta KKM to review. And if you check the CPG, Malaysian Consensus Guideline, this one from Ministry of Health itself, anti-retroviral therapy 2017, we do not recommend giving a prescription longer than 3 months. So maximum 3 months saja. This one 2017. And this study, 2 years. And the latest one, anti-retroviral therapy, this year, you can check page 98. Now, PrEP, you can start only for 90 days supply. And at the same time, dia ada daily dose. Then dia ada event-driven PrEP ataupun on-demand PrEP. So that means dia punya maximum is not 3 months dah. Dia beyond 3 months. And you must remember, many dia tidak ada menopause. Selagi dia, apa orang kata, alive, dia still, apa orang kata, desire to still on. Desire to still on. Even though dia 60 years old ke, 70 years old ke, the desire to still on. So kalau dia still practice and set, the chances to get HIV tu akan jadi higher. Okay. So that's why we need to look at from Islamic perspective in terms of maqasid syariah, in terms of religion, in terms of life, akal, keturunan. So kalau man sets man, you don't get baby. Even animal pun don't practice this. That's why we need to look from this area maqasid syariah ni. As if bila kita give PrEP ni, kita macam indirectly or directly kita encourage the activity. And how about hukum? That's why we really appreciate our third speaker, Ustaz Izwan, to comment. Maybe Mazif Fatwa akan give their own hukum, but just to comment lah. And then in terms of cost untuk rawatan after 2 years. And then keadilan untuk ada pesakit, diabetic patient, hypertensive patient, cholesterol. Why must we give special treatment to LGBT? When diabetic patient pun, they also need special treatment. And PrEP, they also have side effect, kidney problem, and then you need to check the bone density, and all this need monitoring, and this will incur costs. Okay, and that's why 6 lecturer from 6 different university, kita give our own statement. We hope the Ministry of Health to review. We strongly urge MOH to review this plan. Bukan kita again, kita just minta dia review and look at from the Islamic perspective too. From other study, so kita check from other study, from other research. So they mention PrEP on sexual risk behavior among adolescent and young people. So PrEP ni dia increase preference for condomless sex and reduce need and decrease in use of condom, and also increase in sexual partner and sexual encounter. Also neglect of other HIV prevention strategy. So PrEP initiation may be associated with increased interest in sexual activity and risky sexual behavior. And another study also mentioned rapid decrease in consistent condom use, which could undermine PrEP's effectiveness. Okay, and another study, gay and bisexual men confirm very high rates of diagnosis of sexually transmitted infection, particularly gonorrhea, syphilis, chlamydia, and etc. Okay, this study published in New England Journal of Medicine found that 41% of patients who got PrEP later tested positive for another STI, compared to 33% of those in the control group. And 30% of new cases of gonorrhea in the US are now resistant to at least one antibiotic. So US Center called this an urgent threat. So you maybe settle HIV, but you have so many problems after that. That's why we suggest Ministry of Health to review. Okay, so brother and sister, kalau kita study the history, homosexuality actually removed in DSM-2 in 1973. And 1990, WHO removed homosexuality in ICD-10. And 2018, WHO mentioned transgender is not a mental illness. Even American, they kata homosexuality is not a mental disorder, thus there is no need for a cure. So tak payah rawat. So apa kita nak bagi PrEP? Dia ni normal, so kita tak payah rawat. So because there is no need for a cure, that's why now men they also wear tudung. Lelaki pun dah pakai tudung. This one 2017. 2022 men dah pakai purdah. Can you imagine? Because we claim homosexuality, no need for cure, no need for treatment. So this is the complication. So this brother is Shasha Muhammad Izwan. This brother Muhammad Termizi, Gigi. This one October 2022, very recent. So this guy Shasha, tarik telefon dia pakai tudung, can you imagine? And this is another transgender male to female, you know, men bila dia apply tudung with makeup, saya pun rasa nak bergambar dengan dia. Excited. Kalau the original, the real woman, for sure saya tak berani. Tapi because this is transgender, that's why kita rasa nak tengok betul ke. And this guy, this is transgender from Perlis. Dia betul-betul dia interested on Sharifah Aini, dia pun jadi macam Sharifah Aini. You dengar suara dia, ya Allah, macam perempuan. That's why brother and sister, LGBT needs treatment. What happened today, kita treat HIV, but the LGBT we ignore, we forget. For us, this is your right. So this is wrong. The concept is wrong. That's why we need to treat LGBT. Whatever DSM said, ICD-10 said, WHO said, we need to review. We need to have our own CPG. We need to focus on LGBT. Even WHO mentioned definition of health, you need to include spiritual. So we need to use spiritual therapy for this community. Okay, so in IIUM, we use spiritual therapy. We have Quranic class every week. So kita ada street dakwah every 2 months. So these people are our students. So student pun kita expose how to approach this group. And we have also Nusantara Ibadah Camp. This one 2022. This one before COVID and this one during COVID. Even during COVID pun kita buat Ibadah Camp online. And normally during Ibadah Camp ni kita expose patient, kita expose this group to the fundamental, the basic, taking wudu, doing solat. And then those yang show the positive sign, kita offer them, kita sponsor them for umrah. Even kalau kita have a quota, thank you for Jakim, thank you to Jakim for helping us. This guy, kita dapat special quota for Hajj. And the donation coming from public. So back from Hajj, you know what the impact. Dia tolong kawan dia become a Muslim, from a Christian become a Muslim. So the impact of Umrah and Hajj is very significant. And kawan dia, once they become a Muslim, dia do a further study on Islam. He went to Kedah just to study more about Islam. And another method of spiritual therapy is management of dead body. So those yang pass away in Kuantan, kita akan call all the LGBT. Now is your responsibility to help your colleagues, because our public, they feel very uncomfortable to do the management of dead body for these people. So now they understand. When you alive, you always talk about your right, your human right. Now you pass away, this is Allah right. So kita akan mandikan dia, kita remove everything, mascara ke, whatever ke, but the implant will be there. So group ni akan faham. So no point kita nak lawan arus. Better kita follow the fitrah. So cukuplah mati itu sebagai penasihat. So that is the best advisor. So this one yang boleh trigger them to start a new life. So brother and sister, PrEP lebih berkesan berbanding abstinence cegah HIV dalam kalangan homoseksual. We have no objection. We agree. But to serodiscordant couple. For homosexual couple yang man to man ni, this one yang kita against. That's why kita minta review by the KKM Ministry of Health. So from our observation, spiritual therapy. So maknanya, other than PrEP, we have another option, spiritual therapy. And we found that actually there are no side effect, no depression, no anxiety, no suicidal idea, no social isolation. Even though American, European, dia kata kalau you start the spiritual therapy, conversion therapy, they will have all these side effects. And we notice they start the U-turn after 5 years intervention and complete transformation after 10 years. So it's proven safe from our finding. So this guy, dia basically a transgender, male to female. He was the sex workers. But when they start U-turn, even quantum community give him a second chance. So they got married. He was married at the age of 50. So the wife about 22. Okay. So 2016 they got married. 2022 we sponsored him for Umrah next year, 2023. This is his son. So they are normal. They can get married. They can have their own children and their own family. And this is another guy, purple, ataupun his real name Muhammad in 2010. He was considered as a hardcore transgender, very degil. And then 2013 dia start U-turn. 2013 start U-turn because of the advice given by Ustaz. Ustaz kata our Prophet Muhammad SAW that left us 1,400 years ago. And he lived in this world just 63 years. So which one you prefer? You want 1,400 in alam barzakh or you want 63 years in alam dunia? They all pun dah trigger. That's why our advice, our counselling, our psychotherapy, that one actually very much significant. Even though American kata psychotherapy is not needed, is not apa orang kata applicable pun. Okay, this purple in 2014 they removed the breast implant partially. And then they got married in 2018 with 4 children. So dia pun normal, dia ada his own family. Okay, then kita buat full breast implant removal in Summit 2020. So kita dah remove the residual of the breast implant. And then June 2022 dia buat second engagement. So maknanya pun dia buat poligami. Nampak tak? Maknanya pun poligami. So that means spiritual therapy actually focus on LGBT. So the moment you focus LGBT, it can be treated, can be cured, automatically kita prevent HIV. That's why we don't need PrEP. Okay, this is another study. Nabilah in 2010 as a sex worker. So kita start intervention. After 10 years, dia dah start the feeling to remove the breast implant. And this is Razman, the same person. Now dia become normal people, tak ada dah working as a sex worker, dia dah ada decent job which is halal and much better from the previous. Okay, this is another guy. This one from Thailand. This one from Thailand 2012. So kita start intervention 2018 dia dah start U-turn. This is the latest status 2022. So that's mean this method is universal because this is spiritual therapy. It's not only formulation. You can apply to Thai, you can apply to Indon. And the result also similar. Tidak ada beza pun, sama. Dia berubah, dia boleh berubah. Okay. But other than PrEP, there is another issue, recognition of a third gender in Malaysia. So Suakam, they propose through one research to develop a comprehensive legislative reform to set out guidelines for gender recognition for transgender people in Malaysia. So Masa and 150 NGO, dia against this kajian ke arah pengiktirafan gender ketiga by Suakam ni. So this NGO dia against, dia basically dia disagree. And to iktiraf gender ketiga bercanggah prinsip agama and fitrah. Maybe Ustaz Izam boleh komen sikit nanti. So impact gender ketiga ke atas anak-anak, impact negatif terhadap kesihatan fizikal dan mental terhadap kanak-kanak juga semakin membimbangkan apabila gender ketiga dilihat sebagai suatu fenomena normal. Dan ibu bapa dan pakar perundangan terpaksa mengekang pihak-pihak yang berselindung atas nama kesihatan yang menawarkan hormon pertukaran balik dan pembedahan pertukaran jantina yang tidak berbalik. Because bila you offer surgery, it become irreversible. And it's happened in Western country, and as gender clinic should have challenged me more over transition. That's why brother and sister, sometimes bila you offer something, you must offer the pro and cons too. And this guy maybe dia tak dapat proper explanation, so bila dia go for surgery, and bila dia nak U-turn, cannot, because this is irreversible. Okay. So Malaysia cannot accept same-sex marriage, said our ex-Prime Minister Tun Mahathir in 2018. So walaupun kita against this concept, this idea, tapi the strategy, the effort towards it is slowly and is still moving. That's why brother and sister, PrEP, third gender recognition, and finally same-sex marriage ni, we really hope it's not happen in Malaysia, insyaAllah. So in conclusion, wahai orang-orang yang beriman, kalau kamu membela agama Allah, nescaya Allah membela kamu untuk mencapai kemenangan dan meneguhkan tapak pendirian kamu. So brother and sister, LGBT ni, we shouldn't see just from medical perspective. We also need to consider Islamic perspective. Then it become comprehensive and holistic. So syawat, when it comes to syawat, desire, solat is the best solution. So introduce solat at the early stage. And we need to use our reference, Al-Quran and Hadith, not only CPD. Even though CPD is good, it helps us a lot, But don't forget our Al-Quran and Hadith, because this one is apa orang kata dulu kini selamanya tak pernah updated, tak pernah berubah. Dia sama je compared to our CPG. And when we rawat LGBT, you see his tudung disappear. He was our staff in IIUM Kuantan. Now he got a better job, but at least not as sex workers. So when you treat LGBT indirectly, you prevent HIV. What happened today? Kita just focus on HIV, but we forget the LGBT. When the LGBT actually is the root of the problems. So keep on giving advice. Keep on giving advice on solat, even though LGBT community not interested to listen to. So our job, kita just deliver. Either they want to change or not, that is their problem. It's not our problem, because hidayah belongs to Allah. It's not belong to us. So our job just to advise, just to deliver the message, and never give up. Jangan give up. Kita kena istiqamah, consistent and persistent in doing the dakwah for LGBT community. And these are the outcome. These are the output. LGBT can be treated and cured. So PrEP is not indicated anymore kalau kita fokus on LGBT. So moderator, thank you very much. That's it. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Terima kasih Masya Allah atas kupasan oleh Prof Samsudraman sebentar tadi dengan usaha dakwah yang kita tengok dan juga keberhasilan dalam masyarakat transgender yang kita dah reach out. Sebelum tu kita ada satu soalan Prof di chat box. Dia kata kat sini, saya perasan Prof Samsul banyak tak setuju dengan program PrEP untuk golongan MSM disebabkan oleh isu kos. Katakan kalaulah kos perubatan PrEP bukan isu yang besar, adakah kita akan lebih bersetuju untuk diberi kepada golongan berisiko seperti MSM?
Terima kasih pada saudara yang bertanya. Dia bukan isu kos saja. Kita nak kena tengok isu dari sudut ada STD tu. Kalau kita start PrEP, okeylah, betul lah HIV kita boleh reduce, kan? Tapi ada STD, gonorrhea, macam yang previous artikel yang saya mention tu, gonorrhea, dia dah jadi resistant, tak boleh selesai. So kita settle HIV je, tapi yang ada STD tu tak settle. Yang keduanya, kita kena consider hukum. PrEP ni diberi kepada dos yang non-HIV. Nampak tak? Dia bukan HIV, non-HIV. So maknanya dia bukan pesakit. Dia bukan pesakit. Kita bagi ubat pada pesakit. Tapi yang ni non-HIV, so dia bukan pesakit. So bila dia bukan pesakit, maknanya kita indirectly menggalakkan dia. So dia akan buat lagi dan lagi perbuatan tu. Dan mereka ni umurnya 20 to 29, muda lagi. So sexual desire tu sangat kuat, sangat tinggi. So dia akan buat banyak kali. So kita takut bila dia buat banyak kali, lambat laun dia akan end up dengan HIV. So bila end up dengan HIV, daripada PrEP now hard pula. Nampak tak? Jadi masalah tu tak selesai. Kita tidak merawat puncanya tu. Kita just merawat complication dia. That's why yang kita rasa kita tak bersetuju. Kita minta pihak Kementerian Kesihatan untuk tengok balik supaya jangan consider PrEP ni dari sudut medical HIV saja. Kena tengok juga isu hukum itu. Hukum ni saya tak nak sebut, saya bukan ahli. Hukum ni kita serah pada majlis fatwa. Mungkin Ustaz Izzuan ada jawapannya. So kalau hukum nanti ada, kita akan faham. Dalam isu PrEP, kalau serodiscordant couple, okey, kita terima. Sebab mereka ni pesakit. Dia dah ada HIV. Jadi takut so isterinya kena. Dan okey lah. Tapi dalam kes yang satu lagi tu, memanglah kos pun mahal. Satu pesakit kalau dia beli, yang gay tu kalau dia beli, kurang-kurang RM1,000 dia terpaksa spend untuk PrEP saja dalam 1 bulan. So nampak macam it's a good business. Ni yang kita minta, kalau boleh nak diberi percuma pun tak elok juga, menggalakkan juga. Jadi maknanya kalau you nak juga PrEP, you bayar lah. Bukanlah dengan pakai taxpayer money tu. Itu pada pandangan saya lah. Harap menjawab.
Terima kasih Prof. Ada soalan daripada para hadirin? Kita buka. Boleh tanya, boleh buka mikrofon seorang.
Sekejap, tengok chatbot pun ada. Dia
chatbot.
chatbot ada. Oh, ada.
Yang baru satu tadi, Prof. Kalau tak ada,
Dan kena ingat, kita bukan diskriminasi golongan LGBT atau golongan MSM. Kita tak diskriminasi. Bahkan banyak our program dakwah tu kita libatkan seramai mungkin. Kalau kata diskriminasi, maknanya kita ignore. Kita tak buat apa-apa program tu. Nanti kau lah, this is your right, you nak enjoy and accept, okay lah, enjoy lah, tak ada masalah. Itu maknanya kita diskriminasi. Tapi kalau kita buat program dakwah, kita ajar dia, nak kata diskriminasi macam mana, saya tak nampak tu. Kita jemput dan kita tak pernah charge pun. Bahkan UAA, JAKIM, JAIB dan semua jaga apa, memang panggil semua. Memang kita galakkan untuk mereka sama-sama belajar. Dan kita tak paksa pun untuk mereka berubah. Pada kita, biarlah solat itu yang mengubah mereka. Sebab kalau kita boleh mengubah mereka, sudah pastilah parents mereka yang akan berjaya dulu. Nampak tak? Ibu bapa yang akan berjaya dulu. Tapi kalau ibu bapa pun mereka ignore, kita ni siapa? Lagilah susah. Jadi apa yang kita buat, kita ajak mereka sembahyang. Sembahyang tu aja akan melentur hati mereka itu. Jadi tidak timbul soal diskriminasi sebenarnya. Diskriminasi ini ditimbulkan oleh pihak-pihak tertentu yang mengatakan kita diskriminate, kita taksub. Sedangkan kalau kita pakai kaedah yang ada pada hari ini, kaedah Western dengan hard ke prep ke, saya nampak statistik HIV makin meningkat. Tak turun pun. Wahal 2030 tu kita nak ending age dah. That's why we need to have another strategy. Kita tak boleh pakai same strategy. Kita tak akan dapat different result. Itu sajalah yang kita minta. Kita minta kena adalah spiritual therapy itu samalah pada pandangan saya lah. Okay, quantify the success rate of the spiritual therapy that you have done. So kita dah show you the slide tadi. Itu yang case tadi. Itu just tips of the iceberg aja. Kalau saya were given chance by moderator 1 hour presentation, I can show you more even with the video. But now I given just half an hour, so it's quite difficult lah. So kalau you mention about success rate, I cannot tell you 100%. Faham tak? 100%. Tapi kita ada success story yang macam tadi, yang dah berkahwin, ada anak. Itu consider 100% itu. Tapi to me, even kalau they join the dakwah program pun, itu kita dah consider success rate. Because these people, they are sex workers. Sex worker normally they are not interested about dakwah program. Dia akan kata this is my right lah. Kenapa pula saya nak ikut your program? Tapi bila dia join, itu pun kita dah kata berjaya dah tu. So berjaya can be 50%, can be 1%. So dia very subjective. Even kalau you tanya the same question to MSc, to MA, what is your success rate? Susah juga. Cuba you tanya this question to MSc, MA, what is their success rate? Nampak tak? Susah juga. Dia boleh kata 100%. Dia just manage HIV. Tapi yang LGBT tu what happened? The problem now, kita just manage the complication. Tapi the underlying factor tu, there is no solution yet. That's why in IIUM, together with JAKIM, together with JAIB, kita buat holistic management. Maknanya kita combine HIV plus spiritual. And that is the outcome. Itu dia. Thank you.
Baik, Prof. Ada soalan daripada saya. Saya nak bertanyakan, ada pengalaman Prof sebelum ni. Adakah Prof pernah berkolaborasi dengan, maksudnya negara-negara region seperti Indonesia ataupun Brunei? Macam tadi Prof dah tunjuk di Thailand kan? Bagaimana dengan region yang serumpun dengan kita?
That's why our program tu kita kata Nusantara. We put as Nusantara. So Nusantara ni dia consist of Indonesia, Singapore, Brunei, dan memang kita ada networking. Kita ada networking with this country. Even Indonesia pun join. Indonesia pun join, and Indonesia pun berubah. Indonesia pun berubah. Even masa kematian pun, yang management of dead body pun, kita manage Indonesian body. The recent one kita manage Indonesian body together with SASMED. SASMED ni actually our, boleh kata our funder jugalah, because the breast implant surgery itu so far we have done 20 cases. 20 cases kita dah remove the breast implant, and these people they come secara sukarela. Kita tak paksa pun. Kita tak kata you kena remove breast implant tu, tak. Tapi dia volunteer. Dia volunteer. Sebab apa? Dia rasa cukup dah jadi maknya ni, berapa lama nak hidup. That's why bila kita remove dah 20 case, dan dia free of charge. And this program dia bukannya one man show, bukan saya seorang. Dia ada even top management university pun ada. Our trans director pun involved. Our director SASMED pun involved, our deputy director pun involved, campus director pun involved, ramai lecturer pun, our surgeon, my department pun ada. Dia bukan one man show. That's why kalau kita nak buat program dakwah ni, kita jangan buat secara alone, secara silo. Dia kena ada multi network and then kita kena multitasking. Gitulah.
Baik, Prof, ada soalan. Kita ada lagi 5 minit insyaAllah untuk Prof. Ada suatu soalan yang sini Prof boleh jawab daripada Dr. Husna. Assalamualaikum Prof. Saya ingin bertanya pandangan Prof tentang pemberian PrEP. Many people yang disagree sebab they believe we have to treat the root cause rather than the symptom.
Betul. Dari sudut pandangan kami, kita memang tak setuju lah. Kita tak setuju PrEP kepada kumpulan gay yang non-HIV, status dia negatif. Maknanya mereka bukan pesakit. Faham tak? Tapi yang serodiscordant mereka pesakit. Mereka follow maqasid syariah tu. Tapi yang gay ni, yang HIV status negatif, di mana maqasid syariah yang kita nak ikut dalam kes ni? Itu isu dia. Nak kata keturunan, lelaki dengan lelaki. Dapat baby ke moderator, lelaki dengan lelaki ni? Saya rasa haiwan pun tak buat. Jadi bila haiwan tak buat, kenapa kita buat? Dah tu kita nak bagi PrEP. Itu yang menyebabkan kita rasa tak setuju lah. Sangat-sangat tak setuju. Kemudian dari sudut agama. Rosak agama kita kalau lelaki dengan lelaki ni. Orang bukan Islam akan ketawa kat kita. Apa dah jadi dengan Islam ni. Jadi kita nak jaga nama agama juga. Our reputation juga kan. Agama. Lepas tu nyawa. Bila lelaki dengan lelaki dapat HIV, dapat banyak lagi penyakit-penyakit STD, nyawa dia macam mana? Kita takut dia meninggal dunia muda dan banyak kes yang kita jumpa meninggal dunia pada umur 20 tahun disebabkan dari masalah HIV. Walaupun statistik kata heart tu bagus, tapi bukan semua pesakit ini compliance-nya bagus. Ada yang tak makan ubat, ada yang degil, nampak tak? Jadi pasal tu kita nak kena jaga maqasid syariah tu. So atas dasar ni lah kita minta pihak Kementerian Kesihatan tengok balik. Kenapa nak mudahkan? Jadi ini kita serahkan kepada pihak berkuasa lah, majlis fatwa. Bukan saya lah untuk kata begini-begini. Kita just bagi pandangan kita. Pandangan kita memang kita tak setuju atas dasar agama itu sendiri. Dan banyak lagi faktor-faktor lain lah. Dan bahkan research daripada luar negara pun mengatakan benda itu negatif. Macam yang saya tunjukkan tadi lah. Okey, boleh ke moderator?
Ya, boleh. Prof boleh jawab lagi satu soalan. Kita ada lagi 2 minit.
Boleh. Bagilah saya 1 jam, senang. Setengah jam susah nak jawab.
Rasanya Prof ni session yang paling hangat ni. Setakat ni. Okay. Kita ada soalan yang terakhir kat sini. For non-Muslim LGBT, tapi rasanya Prof ada sebutkan tadi kan, how do we approach them and give them the spiritual training?
Thank you to the person yang tanya soalan ni. Non-Muslim LGBT, kita bantu sama. Sebab kenapa kita bantu, ada banyak faktor dia. Yang pertama, non-Muslim LGBT ni, klien dia Muslim. Tu kita kena ingat. Klien dia adalah Muslim. Pasal tu kita tak boleh ignore our non-Muslim colleagues. Non-Muslim colleagues pun kita bantu. Kita ikram dia. Kita buat macam Nabi buat pada orang yang Yahudi. Yahudi tu duk hina dia, Nabi bantu. Sampailah Nabi wafat, barulah non-Muslim tu tahu yang Nabi yang bagi dia makan. Baru orang tu masuk Islam. Jadi kita ikram dia. Dan kita tak pernah nak ajak dia masuk Islam pun. Tapi mereka sendiri yang nak masuk. Nampak tak? So bila kita tunjukkan akhlak kita, mereka nampak kecantikan Islam tu. Tapi hari ni mereka tak nampak sebab mereka bergantung pada akhbar-akhbar yang memburukkan Islam. Tapi bukan kita nak pergi ke arah tu lah. Cuma kita nak bagi tahu non-Muslim LGBT memang kita bantu. Kita tunjukkan yang terbaik untuk mereka sebenarnya. Sama ada mereka nak terima atau tidak, itu cara yang kedua lah. Itu cara yang kedua. Okey, lepas tu non-Muslim ni kalau di Kuantan ni kita tak ramai sangat lah. Kalau ikutkan sebelum ni kita ada lebih kurang 5 orang. So daripada 5 orang itu 2 orang dah masuk Islam. 3 lagi tu dia dengan dunia dia lah. Dan kebanyakan non-Muslim ni daripada negara Thailand. Thailand ada, orang India kita pun ada. Jadi kita treat sama je. So kalau bila pergi buat semayang, mereka takkan join lah. Mereka akan buat cara mereka. Lepas tu bila kita bincang dari sudut moral, dan mereka akan masuk. Kita tak discriminate pun. Walaupun dia non-Muslim. That's why bila ada setengah pihak kata kita discriminate, sebenarnya dia tak faham. Saya jemput lah, kalau sahabat-sahabat saya daripada Malaysian Aid Council ada dalam program ini, saya jemput. Datanglah ke program kita. Free of charge, kita sponsor semua. Tengoklah sendiri. Why don't kita work together? Kita bekerjasama untuk membantu golongan LGBT. So kamu rawat HIV, kami rawat LGBT. So kita bekerjasama. Hari ini kamu rawat HIV, kamu tak rawat LGBT. That's why masalah LGBT itu senantiasa ada, senantiasa naik. So bila senantiasa naik, HIV pun naik sama. Itulah lebih kurang moderator. InsyaAllah kalau diberi masa yang panjang boleh cerita lagi, boleh tunjuk video. Ustaz Izwan pun ada video sebenarnya, tapi 30 minit tak sempat lah. Lebih kurang itulah. Harap membantulah.
Okey, Masya Allah. Terima kasih Prof atas kupasan tajuk gender dysphoria from social perspective, and it was such inspiring success story lah yang kita nampak tadi. Baik Prof, terima kasih banyak-banyak. Kita rasanya kita boleh bergerak ke seterusnya, kupasan topik yang seterusnya. Sebelum itu, jangan lupa kepada para hadirin, Datuk Datin, Doktor, Profesor untuk klik kita punya attendance link, dan untuk para doktor medical, nanti QR code untuk CPD pun akan dipancarkan di akhir seminar nanti. Baik, tanpa membuang masa, saya ingin menjemput Dr. Muhammad Izwan bin Muhammad Yusof daripada JAKIM untuk mengupas topik gender dysphoria from Islamic perspective, khunsa dan mukhannas, hukum fiqh dan bagaimana kita berurusan berlandaskan ajaran agama Islam. Dengan segala hormatnya saya mempersilakan.
Assalamualaikum warahmatullahi wabarakatuh. Terima kasih kepada yang berbahagia Ustaz Abdul Rahman selaku moderator kita pada pagi ini. Seterusnya yang saya kasihi barisan pembentang, sebentar tadi baru selesai Profesor Dr. Samsul Rahman yang juga merupakan rakan strategik kami di JAKIM, dan tidak lupa juga kepada pembentang pertama tadi dan pembentang seterusnya selepas ini, dan kepada semua para audiens dan partisipan yang hadir untuk seminar kita pada hari ini. Jadi sebagai mukadimah awal, saya Dr. Muhammad Izwan bin Yusof daripada bahagian keluarga, sosial dan komuniti JAKIM, insya-Allah akan berkongsi dengan tuan-tuan dan puan-puan semua tentang satu tajuk, kecelaruan jantina dari sudut pandangan Islam, khunsa dan mukhannas. Okey, boleh terus kita ke slide kedua. Baik. Kalau kita melihat kepada kajian ini, saya nak memaklumkan di peringkat awal, apa yang saya bentangkan ini merupakan ekstrak daripada kajian kami bersama yang telah mendapat geran penyelidikan daripada bahagian penyelidikan JAKIM berkenaan mukhannas dari sudut fiqh dan perubatan dan kaitannya dengan transgender. Ketua kajian adalah Profesor Dr. Muhammad Nasir bin Abdul Majid. Seterusnya bersama dengan kami ahli-ahli penyelidik, Profesor Dr. Irwan Subri juga dalam bidang fiqh sebagaimana Dr. Nasir. Kemudiannya Profesor Dr. Rafidah Hanim dalam bidang perubatan biologi, Dr. Umi Azlin seorang psikiatris, kemudiannya ada RA kami iaitulah Ustazah Fatin dan saya juga sebagai penyelidik bersama. Jadi apa yang saya akan bentangkan ini adalah apakah pandangan Islam khususnya berkenaan tentang khunsa dan juga mukhannas. Baik. Sebenarnya kalau kita lihat kepada perbahasan para ulama, antaranya Imam An-Nawawi. Imam An-Nawawi, kalau tuan-tuan puan-puan masih ingat, dia merupakan pengarang kepada kitab Riyadhus Salihin yang menghimpunkan hadis-hadis yang terpilih, juga pengarang kepada kitab hadis 40 yang biasa digunakan oleh oleh kita di pengajian di peringkat masjid dan surau. Baik. Kalau kita lihat kepada definisi mukhannas ini, dia terbahagi kepada dua. Yang pertama, mukhannas khalqi, yang disebut sebagai diciptakan sebegitu secara semula jadi ataupun secara aslinya, mereka tidak mengada-ngadakan atau tidak berpura-pura berperangai seperti wanita, juga menyerupai wanita dalam berpakaian, percakapan dan pergerakan mereka. Dalam keadaan ini mereka tidak dipersalahkan, tidak berdosa, tiada aib serta tiada hukuman dikenakan kerana dimaafkan. Manakala yang kedua, mukhannas yang berlagak, mukhannas yang kedua ini dipanggil sebagai mukhannas ghairu khalqi. Mukhannas ghairu khalqi disebut sebagai mukhannas yang berlagak seperti wanita dalam tingkah laku, diam dan geraknya, juga sengaja menyerupai wanita dalam percakapan serta berpakaian. Maka golongan ini dicela seperti mana yang disebut dalam hadis. Baik, hadirin, bila kita kata tentang mukhannas ini, jantinanya adalah lelaki. Okey, saya ulang, jantinanya adalah lelaki. Jadi di sana kalau kita lihat dalam konteks masyarakat, ada kumpulan yang biasa kita panggil sebagai lelaki lembut. Okey, lelaki lembut yang kadang-kadang cara dia berjalan, cara dia bercakap dan kecerungan dia mungkin ke arah wanita. Tetapi dalam konteks hukum agama, selagi mana mereka tidak berpenampilan seperti wanita, maka tidak ada dosa bagi mereka, dimaafkan. Pada waktu yang sama, sebagaimana kata seorang lagi ulama, Ibnu Hajar Al-Asqalani, mereka mesti sedaya upaya meminimumkan sifat-sifat kewanitaan itu. Jadi kalau kita perasan dalam konteks masyarakat kita, mungkin rakan-rakan kita di kampus ataupun di tempat kerja, memang ada lelaki lembut ini. Dan mereka berpakaian seperti lelaki, berkahwin, ada anak, minat memasak misalnya, mengemas rumah, kita kata menjahit, kerja-kerja orang perempuan. Jadi mereka ini dianggap sebagai mukhannas khalqi, maknanya lembut secara asli ataupun sejak lahir begitu. Tetapi dalam konteks yang kedua dianggap sebagai mukhannas ghairu khalqi. Dia jelas lelaki, tapi oleh kerana sebagaimana kita bincang juga tentang gender dysphoria, mereka merasakan ketidakselesaan dengan jantina asal, ada perasaan yang kuat mengatakan mereka lebih kepada jantina yang berlawanan, maka sudah ada kecenderungan untuk berpenampilan seperti jantina berlawanan. Seperti mana seorang lelaki, tapi dia merasakan dirinya dekat sebagai seorang perempuan, maka dia mula memakai perhiasan wanita seperti gelang, seperti baju, mula membuat pembedahan jantina seperti breast implant dan juga kita kata untuk membuat vagina seperti mana orang perempuan, maka disitulah yang disebut dalam Islam tidak dibenarkan untuk yang sebegini. Okey, next slide. Baik, saya akan terangkan nanti pada sebab ada satu lagi slide yang sama pada slide yang seterusnya. Okey, next slide. Baik, hasil kajian mendapati mukhannas didefinisikan sebagai lelaki yang berperwatakan lembut seperti wanita dari sudut pertuturan atau kelakuan. Ini yang saya katakan di awal tadi, maknanya kita ada di kalangan masyarakat kita, bahkan mungkin ahli keluarga kita, saudara mara kita dan juga rakan-rakan kita, jiran tetangga kita, yang dia ini memang lelaki tetapi dia lembut seperti wanita. Dari sudut tutur bicaranya, cara percakapannya, suaranya dan juga mungkin lenggok jalannya. Dan ia dibahagikan kepada dua golongan, iaitu mukhannas khalqi, semula jadi, dan mukhannas ghair khalqi, yang bukan semula jadi. Maka kami nyatakan transgender ataupun maknya termasuk dalam kategori mukhannas ghairu khalqi. Sebab apa? Sebab seolah-olahnya mereka ada kecenderungan untuk berpenampilan silang jantina ataupun menjadi jantina berlawanan dalam keadaan seolah-olahnya dibuat-buat. Itu yang telah kami dapati dalam kajian kami. Okey, terus. Baik, kalau tuan-tuan dan puan-puan boleh lihat kepada slide ini, kita cuba rumuskan dalam bentuk infografik sebegini. Seperti mana yang kita katakan tadi, mukhannas, lelaki yang bertingkah laku dan berperwatakan lembut seperti wanita, dan ada dua kategori. Yang pertama, khalqi, maknanya semula jadi dilahirkan dengan perwatakan lembut, dan yang kedua, ghairu khalqi, sengaja menyerupai wanita. Okey, next slide. kita cuba membezakan apa yang dikatakan mukhannas dan juga khunsa. Tuan-tuan, kalau boleh saya petik ayat Al-Quran daripada surah Al-Hujurat. Ayat 13, Allah menyatakan, A'udzu billahi minasyaitonir rajim. Ya ayyuhan nas, inna khalaqnakum min dzakarin wa unsa. Ila akhir ayat. Wahai manusia, kami jadikan kamu dari jenis lelaki dan jenis perempuan. Sebab itu kefahaman asal kita bila kita sebut tentang jantina ataupun yang dikatakan sebagai seks ataupun yang dikatakan sebagai gender itu hanya kepada dua sahaja, lelaki dan wanita. Dalam borang pun kalau kita tengok ada ruangan jantina. Boleh jadi dia himpunan daripada dua perkataan, jantan dan betina, maka digabungkan menjadi jantina. Jadi sefaham kita dalam mana-mana borang yang kita isi bila ditanya tentang jantina, kita akan hanya menjawab lelaki dan perempuan. Baik. Bagaimana kumpulan yang ketiga? Kumpulan yang ketiga ini dalam istilah perubatan juga disebut sebagai intersex ataupun khunsa. Khunsa ini dalam Islam diiktiraf dan diakui merupakan satu golongan yang tidak jelas status jantinanya ataupun ada dua alat kelamin. Kalau boleh saya rumuskan begini, lahir seorang bayi, kemudian yang biasa disebut dalam istilah perubatan sebagai mungkin ambiguous genitalia. Maknanya dia ada semacam dua alat kelamin, tapi tak dapat dipastikan apakah jantina yang lebih dekat dengan bayi ini. Maka dari sudut pandang Islam, misalnya pandangan Imam Malik, ketika mana kita nak tentukan jantina si anak ini, maka biasanya akan menunggu pada usia akil baligh. Kalau anak ini sudah mula keluar air kecil ataupun air kencing daripada kemaluan lelaki dan sudah mula ada bulu-bulu seperti misai, janggut, maka kita boleh anggap ia lebih hampir kepada lelaki. Tetapi sebaliknya kalau dia mula keluar air kencing daripada kemaluan wanita dan sudah mula datang haid, maka dianggap sebagai wanita. Baik. Maka kalau hari ini, kalau saya difahamkan di peringkat Jabatan Pendaftaran Negara, ketika mana anak-anak yang lahir ini tidak jelas apakah jantina yang lebih dominan, biasanya akan di-assign dekat MyKid-nya ataupun di kad pengenalannya sebagai ragu. Sehinggalah dapat ditentukan apakah jantina yang lebih dominan. Saya nak mengatakan dalam Islam ini, golongan khunsa sebagai golongan yang diharuskan untuk melakukan pembedahan jantina. Dia berbeza sama sekali kalau dia jelas lahir seorang lelaki, tiba-tiba nak buat pembedahan jantina jadi perempuan, itu diharamkan. Manakala dari satu sudut pula, kalaulah dia seorang wanita, kemudian berkeinginan menjadi seorang lelaki, maka itu juga diharamkan mengikut muzakarah fatwa kebangsaan pada Syawal 1982. Baik. Maka dalam hal ini, kalau kita boleh lihat beberapa definisi dan beberapa istilah perubatan sebagaimana jadual yang tertera. Kita lihat kepada mukhannas. Mukhannas yang telah kita katakan tadi, seorang lelaki yang menyerupai wanita. Kemudian istilah perubatan juga disebut sebagai effeminate, okey, ataupun transgender. Manakala klasifikasi diagnosis yang mungkin berkaitan adalah GD, gender dysphoria, ataupun istilah lama disebut sebagai gender identity disorder yang biasanya disebut dalam kitab psikiatris iaitu DSM. Dan kemudian pembahagian golongan ini ada dua, mukhannas khalqi dan ghairu khalqi yang telah kita bincang di awal tadi. Manakala khunsa adalah seseorang yang tidak jelas status jantinanya atau ada dua alat kelamin, istilah perubatan mungkin disebut sebagai intersex ataupun hermaphrodite, istilah terdahulu. Maka klasifikasi diagnosis yang mungkin berkaitan adalah DSD ataupun Disorder of Sex Development. Dan pembahagian golongan ada khunsa mushkil yang tidak jelas dan ada khunsa wadih ataupun ghairu mushkil yang jelas, maknanya walaupun dia ada dua alat kelamin tetapi salah satu itu nampak berfungsi dan lebih dominan. Itu dipanggil sebagai khunsa wadih. Manakala khunsa mushkil ni kita tak pasti. Dia mungkin ada dua alat kemaluan tapi tak pasti mana yang lebih dominan berfungsi. Maka di situ biasa ditentukan ketika usia akil balik. Okey, baik. Next slide. Okey. Kalau kita boleh lihat kepada rajah ataupun infografik ini, kita cuba rumuskan apakah perbezaan khunsa dan mukhannas. Okey, khunsa di sebelah kiri, kemudian mukhannas di sebelah kanan. Khunsa terbahagi kepada dua golongan, iaitu mushkil dan wadih. Kemudian mukhannas terbahagi kepada khalqi dan ghairu khalqi. Baik. Dari sudut yang kita katakan, kita cuba selarikan dengan diagnosis perubatan itu, maka mushkil ini dia berkait rapat dengan CAH, congenital adrenal hyperplasia, dan juga PAIS ataupun partial androgen insensitivity syndrome. Manakala wadih pula disebut sebagai ambiguous genitalia. Mukhannas khalqi disebut dalam kita kata istilah perubatan sebagai effeminate man, maknanya lelaki yang berwatak seperti perempuan, manakala ghairu khalqi yang kita panggil sebagai transgender. Dan di bawah itu disebut ada beberapa disorder of sex development yang mungkin tidak termasuk dalam kategori khunsa, antaranya Turner syndrome dan juga Klinefelter syndrome. Okey, next. Okey. Tuan-tuan, puan-puan dirahmati Allah sekalian, ketika kami mengkaji tentang persoalan mukhannas dan juga kaitan dengan transgender dari sudut fiqh dan perubatan, kami melihat beberapa hukum yang berkaitan. Contohnya, hukuman bersalaman dengan transgender. Contoh, saya seorang lelaki, saya bersalaman dengan seorang transgender. Kalau dia tu asal lelaki tapi sudah berpenampilan seperti perempuan, maknanya kita panggil istilah kita sebagai maknya ataupun transwoman, maka dari satu sudut hukum itu tidak ada masalah kerana dia sama jantina dengan kita pada hakikatnya. Cuma kalau ada berlaku fitnah, misalnya menimbulkan rangsangan syahwat, maka mesti dielakkan. Itu sebagai contoh. Kemudian, hukum pengurusan jenazah transgender. Misalnya seorang maknyah transgender yang telah meninggal dunia. Bagaimana hendak diuruskan? Maka dalam rumusan kajian kami mengatakan ada beberapa kategori. Misalnya yang pertama, sedapat mungkin sekejap ya. Okey, kalau saya katakan tentang hukum pengurusan jenazah transgender, misalnya kalau dia itu seorang maknya, jadi bagaimana hendak diuruskan jenazahnya? Kita syorkan supaya yang pertama, yang menguruskan jenazah transgender ini adalah ahli keluarganya. Itu yang paling utama. Baik. Yang kedua, iaitulah yang kita katakan komuniti transgender itu sendiri. Sebagaimana yang Profesor Sam sebutkan tadi, di Kuantan ada NGO Persatuan Insaf Pahang dan telah berlaku beberapa kematian di kalangan maknyah ataupun transgender. Jadi siapakah yang menguruskan jenazah rakan-rakan mereka ini yang telah meninggal dunia adalah rakan-rakan komuniti. Dengan maksud mereka lebih memahami tentang isu kompleksiti yang berkaitan dengan transgender, maka kita syorkan komuniti transgender untuk menguruskan jenazah rakan mereka. Yang ketiga, barulah diuruskan oleh pihak berkuasa agama ataupun misalnya pihak pengurusan masjid yang boleh menguruskan jenazah transgender ini. Dan ada lagi beberapa hukum yang saya kira tuan-tuan, puan-puan semua boleh klik saja dekat link yang saya sertakan berwarna biru itu di ifiqislam.gov.my yang mana telah dibentangkan kajian ini di peringkat muzakarah Majlis Kebangsaan Ahli Islam yang melibatkan mufti-mufti seluruh Malaysia dan kajian ini termasuk dalam kategori perubatan. Jadi kalau tuan-tuan klik saja di situ, akan tertera apakah hukum-hukum yang telah kita nyatakan dalam slide ini untuk tuan-tuan pergi lebih mendalam. Saya tidak sempat untuk menyatakan kesemuanya, tapi tuan-tuan boleh baca pada link tersebut. Okey, next slide. Baik, kesimpulannya, yang pertama, mukhannas menurut fiqh adalah lelaki yang berperwatakan lembut dan berkelakuan seperti wanita sama ada dalam pertuturan, pergerakan, tingkah laku atau berpakaian. Yang kedua, mukhannas menurut fiqh terbahagi kepada dua golongan. Yang pertama, mukhannas khalqi yang semula jadi lembut manakala golongan yang kedua mukhannas ghairu khalqi disebut sebagai yang bukan semula jadi. Dalam erti kata lain, kelembutan dan penyerupaan kepada wanita itu dibuat-buat dan diada-adakan. Next slide. Yang ketiga, dari sudut perubatan, lelaki effeminate adalah mukhannas khalqi yang mempunyai ciri-ciri kewanitaan secara semula jadi. Kemudian yang keempat, dari sudut perubatan transgender ataupun maknya adalah mukhannas ghairul khalqi yang merasakan identiti gender mereka adalah bertentangan dengan jantina sewaktu dilahirkan. Mereka merubah diri kepada jantina yang bertentangan sama ada dengan cara berpakaian, tingkah laku, pengambilan hormon atau pembedahan molekul jantina, sex reassignment surgery. Okay, next slide. Yang kelima, dari sudut perubatan, khunsa adalah mereka yang mempunyai keabnormalan perkembangan jantina ataupun disorder of sex development sama ada di peringkat kromosom, gonad, hormon, genitalia dalaman atau genitalia luaran yang dapat disahkan oleh ujian perubatan. Yang keenam, dari sudut perubatan, kedua-dua mukhannas khalqi dan mukhannas ghairul khalqi adalah mereka yang tidak mempunyai keabnormalan perkembangan jantina, disorder of sex development, sama ada di peringkat kromosom, gonad, hormon, genitalia dalaman atau genitalia luaran yang dapat disahkan oleh ujian perubatan. Saya nak bagi contoh begini. Ada seorang maknya ataupun transgender yang jumpa dengan saya pada usianya 27 tahun. Dan dia memang penampilan seperti seorang wanita dengan usia yang muda, ada wajah yang menarik dan kita kata sekali pandang itu memang cantik. Baik. Ketika mana dia berhasrat untuk melakukan pembedahan jantina di negara jiran Thailand, maka kita mencadangkan kepada dia untuk melakukan ujian. Ujian hormon, ujian kromosom. Kalau dia masih ragu tentang diri dia, kalau ada dapatan mengatakan dia itu mungkin khunsa. Sebab kita dah kata di awal tadi, kalau khunsa ada asas justifikasi untuk dia melakukan pembedahan jantina, dia haruskan. Tetapi setelah result keluar, kata sahabat saya di dalam bidang ONG ataupun dalam special MDT, multidisciplinary team di sebuah pusat perubatan yang diiktiraf oleh kerajaan, dia mengatakan, Ustaz, walaupun dia telah makan hormon estrogen seawal usia 14 tahun sehingga usianya 27 tahun ketika ini, tetap hormon testosteron yang biasanya ada pada seorang lelaki adalah dominan dalam tubuh badannya. Dan kromosomnya adalah 46XY, bermaksud dia seorang lelaki. Jadi saya nak mengatakan bahawa berdasarkan dapatan kajian kami ini, bermaksud bila kata transgender ataupun mukhannas ghairul khalqi ini, mereka sebenarnya tidak ada apa-apa keabnormalan perkembangan jantina ataupun disorder of sex development. Baik, yang ketujuh. Sehubungan itu, transgender maknya dikategorikan dalam golongan mukhannas ghairul khalqi dan bukan khunsa kerana mereka tiada masalah dari segi fisiologi dan perkembangan jantina. Okay, next slide. Seterusnya yang ke-8, transgender maknya termasuk dalam golongan yang dilaknat berdasarkan hadis Nabi SAW kerana mereka disebut sebagai al-mutasyabbihin bin nisa, lelaki yang menyerupai wanita. Yang ke-9, seorang yang dilahirkan lembut semula jadi, mukhannas khalqi, sekalipun sekiranya dia telah cross the line ataupun cross the border, melampaui batas dengan melakukan perbuatan at-tashabbuh bin nisa, penyerupaan kepada wanita seperti berpakaian wanita, perhiasan wanita, melakukan breast implant ataupun pembedahan jantina, maka ia juga termasuk dalam perbuatan yang haramkan dan dilaknat. Yang ke-10, hukum hakam fiqh berkaitan transgender ataupun maknya itu adalah mengikut jantina asalnya iaitu lelaki. Okey. Next slide. Jadi ini saya paparkan gambar ahli pasukan kami, Profesor Rafidah Hanim, Datuk Umi Azlin, Ustazah Fatin, Profesor Dr. Irwan Subri dan juga Dr. Nasir yang telah sama-sama melakukan kajian ini. dengan geran yang dibayai oleh bahagian penyelidikan JAKIM pada sekitar tahun 2019 hingga 2020 yang lepas. Maka dengan itu saya sudahkan pembentangan saya. Sekian, wassalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Jazakallah khair kepada Dr. Muhammad Izzuan atas kupasan topik berkenaan dengan gender dysphoria from Islamic perspective, unsa dan mukhannas, hukum fiqh dan bagaimana kita berurusan dari segi ajaran Islam. Setakat ni ada apa-apa soalan daripada para hadirin daripada chat box? Setakat ni tak ada lagi. Atau ada sesiapa yang ingin bertanya boleh buka mikrofon untuk tanya direct. Ada?
Assalamualaikum.
Ya.
Ya, saya Nazir daripada Kuliah Allied Health. Saya nak tanya Ustaz berkenaan bila Ustaz sebut hukum bersalaman dengan orang yang gender dysphoria. Ustaz ada sebutkan dari segi juga boleh sebab hakikatnya perempuan lelaki.
Ya.
Ada tapi Ustaz sebut juga ada exception di mana syahwat tu berlaku. Boleh Ustaz kupas sikit berkenaan tu?
Baik, terima kasih kepada Tuan Nazir yang bertanya soalan tadi. Saya katakan dari sudut hukum asalnya harus kita bersalaman dengan maknyah. Sebagai contoh ya, kalau kami biasa berprogram dengan Prof. Samsul dalam program kemah ibadah melibatkan kumpulan transgender ataupun maknyah ini, biasanya memang kami bersalam-salaman setelah selesai solat berjemaah misalnya. Tapi yang saya katakan ada sedikit pengecualian ketika mana ada unsur syahwat. Yang itu bagi saya, berdasarkan pandangan kajian telah kami lakukan ini, itu dirasai oleh individu berkenaan. Kalau dia merasakan dia tertarik kepada maknyah tersebut dan dia merasakan seolah-olah ada dorongan syahwat ataupun kita kata rangsangan kepada maknyah tersebut, maka sewajarnya dielakkan. Itu yang pertama. Yang kedua, kalau timbul fitnah, maksud saya bagaimana? Contoh ya, katalah saya bersama dengan seorang maknyah di tempat awam, publik. Dalam keadaan yang maknyah itu berpakaian seperti seorang wanita dengan mungkin sedikit seksi ataupun sedikit menonjol dari sudut pemakaiannya. Jadi untuk mengelakkan kita katakan pandangan yang tidak baik, sangka buruk, maka sewajarnya dielakkan bersalaman ketika itu. Itu yang boleh saya jelaskan kepada Tuan Nazir berdasarkan persoalan tadi. Boleh ya?
Terima kasih Ustaz.
Baik, sama-sama.
Baik Ustaz, ada soalan daripada Prof. Haris. Bagaimana orang awam seharusnya berinteraksi dengan mukhannas? Agak merisaukan melihat sokongan netizen terhadap selebriti transgender.
Baik, terima kasih Prof. Haris yang bertanya ya. Saya sebutkan tadi dalam kajian kami ni, kita cuba bezakan ya, maknanya mukhannas tu ada dua. Yang pertama khalqi, lelaki lembut. Yang kedua mukhannas ghairul khalqi yang memang kita spesifik, kita classify sebagai transgender. Baik. Dalam konteks kita dengan kawan-kawan lelaki lembut, kadang-kadang biasa kita mengusik Prof kan, kadang-kadang kenapa lah kau ni lembut sangat misalnya, pakai baju pun warna pink, contoh. Tapi as long dia tidak berpenampilan seperti wanita, maka itu dimaafkan. Cuma sebagaimana pesanan ulama, dia kena minimizekan sifat-sifat kewanitaan itu. Memanglah kita kata tak boleh nak paksa sangat, tapi dia cuba untuk reduce, untuk minimizekan yang terlalu lembut ataupun sifat kewanitaan itu. Okey, itu satu. Jadi bagi saya, dalam konteks kita bila kata mukhannas khalqi, yang lelaki asli lembut ni, okey, itu tidak ada masalah. Kita boleh bergaul seperti biasa. Tapi dengan mukhannas ghairul khalqi ataupun maknyah ataupun transgender, jadi di sini pun kita kata, sebagaimana saya sebut tadi, kita di peringkat JAKIM, kita bekerjasama dengan UI Kuantan dan juga Jabatan Agama Islam Negeri-Negeri. Memang kita buat yang namanya program mukhayyam, maknanya kemah 3 hari 2 malam bersama dengan kumpulan transgender. Jadi sebab itu kita biasa buat program ini di tempat yang agak tertutup supaya tidak menimbulkan tomahan ataupun persepsi yang mereka tidak faham tentang isu yang agak complicated ini. Jadi tuan-tuan, puan-puan bayangkan kami bersolat berjemaah sekali. dalam keadaan mereka masih berambut panjang, masih ada breast implant, tetapi dalam soft yang sama, maknanya soft lelaki sebab mereka asal jantinanya adalah lelaki. Jadi bagi kita dari sudut pergaulan itu tidak ada masalah, cuma ada batas lah. Macam saya katakan tadi, kalau kita sudah ada rangsangan, kalau rasa salam pun macam ada elektrik, macam terminat pula dekat maknya ni, dan dia pula minat kat kita, contoh Prof Haris ya. Jadi kalau itu baiknya dielakkan. Yang kedua, kalau timbul fitnah, maksudnya timbul sangka buruk. Macam saya kata tadilah, kalau saya yang berkopiah, tiba-tiba berpeluk-peluk dengan maknya walaupun atas dasar silaturahim kita nak berdakwah, jadi sewajarnya dielakkan. Kerana mungkin orang awam dia tidak faham tentang kita dengan hasrat berdakwah kepada mereka. Jadi dalam konteks pada hari ini kita faham beberapa ikon atau selebriti transgender yang mendapat tempat dalam masyarakat, sama ada di media sosial seperti TikTok ataupun Instagram. Jadi kita katakan kepada orang awam, kalau boleh kita kena bezakan. Mereka itu jelas adalah seorang transgender. Jadi kalau kata mereka berpenampilan seperti perempuan, tetap kena ingat jantina asalnya adalah lelaki dan hukum hakam syariah berkaitan dengan mereka itu balik kepada lelaki. Dengan maksud, kalau dia meninggal dunia, jenazahnya diurus seperti jenazah seorang lelaki. Walaupun dia sudah melakukan pemberian jantina, ada breast implant dan sebagainya, tapi dia hukumnya balik kepada jantina asal sebagai seorang lelaki. Wallahu a'lam. Terima kasih.
Terima kasih Doktor atas penjelasan sebentar tadi. Dari sudut pandangan kami sebagai sebuah organisasi SASMAC, soalan daripada saya lah, bagaimana dalam kami menguruskan pesakit transgender. Seperti yang mungkin Ustaz tahu, sebagai sebuah syariah compliance hospital, kita mempunyai agak strict lah, maksudnya kalau patient pesakit lelaki dengan perempuan, dengan staff yang perempuan. Tapi bagaimana dengan kita nak handle pesakit yang hadir dengan status sebagai transgender dan mungkin dengan demand untuk masuk ward perempuan sedangkan dia adalah seorang lelaki. Mungkin Ustaz boleh kupas sikit.
Ya, terima kasih kepada Ustaz Rahman. Saya kira dari sudut pendirian kita dan pandangan hukum kita jelas. Walaupun dari sudut pengasingan ward itu ada ward lelaki dan ada ward wanita. Jadi ketika datang seorang pesakit transgender, sepatutnya mereka diletakkan di ward mana. Sudah pasti dari satu sudut yang kita katakan, bila kita base kepada IC dia, jantina dia, dia seorang lelaki pada hakikatnya. Tinggal lagi dia sudah berpenampilan seperti wanita. Jadi dalam konteks ini bagi pandangan kami, sewajarnya dan sebaiknya kita menguruskan dia seperti seorang pesakit lelaki. Cuma saya difahamkan juga di setengah-setengah hospital Dr. Rahman ya, kadang-kadang mereka diletakkan di tengah-tengah. Maknanya di ward lelaki pun tidak, ward perempuan pun tidak. Ini yang saya katakan kadang-kadang timbul isu dalam masyarakat. Sebagai contoh, kalau seorang maknya ketika di luar, kalau ada tandas awam, mereka akan masuk ke tandas mana? Tandas wanita ataupun tandas lelaki? Sudah pasti dengan penampilan itu, biasa-biasa mereka akan masuk ke tandas wanita. Jadi di sini orang perempuan akan merasakan privasi mereka sudah diceroboh. Itu satu hal. Sama juga kalau solat di masjid. Mereka akan solat di saf mana? Saf lelaki atau saf perempuan? Kalau saf lelaki, sudah pasti yang jemaah lelaki pun rasa lain macam ni. Ni mana pula datang orang perempuan ni, contoh. Sebab mereka melihat kepada physical appearance itu. Kalau masuk saf perempuan, orang perempuan pula rasa tak selesa. Jadi kerana itu kita katakan sememangnya kumpulan transgender ini kita nasihatkan untuk mereka solat saja di rumah sehingga mereka boleh berusaha menukar penampilan mereka kepada jantina asal mereka kembali kepada fitrah. Jadi dalam konteks tadi saya katakan pada Dr. Rahman, itu terpulang kepada protokol ataupun SOP di peringkat hospital dan juga mungkin ada beberapa budi bicara kerana kita faham dalam konteks ini dia agak complicated, tapi kalau kita berpegang kepada hukum, mereka dirawat sebagai seorang pesakit lelaki berdasarkan jantina asal mereka. Wallahu a'lam.
Jazakallah Ustaz. berdasarkan pengalaman yang pernah saya hadapi lah. Sorry Ustaz, saya bukan Ustaz Doraman, saya
Okey, tak apa. Bakal Ustaz
berdasarkan
insya-Allah.
pengalaman yang pernah diuruskan sebelum ni lah di hospital, kita sebab demand daripada pesakit kan untuk masuk ward wanita, tapi kita tak boleh, macam Ustaz cakap tadi, dia mengganggu privasi pesakit wanita. So apa yang dilakukan oleh pihak hospital adalah letakkan dia di bilik perseorangan tapi di ward lelaki lah, supaya dia tidak bercampur dan juga dia tidak mengganggu.
Betul.
That's one of the ni lah. Okay, baik. Solution, yes. Ada soalan daripada chat box. Adakah golongan transgender tersebut boleh menjadi imam kepada lelaki atau kepada golongannya?
Okey. Dalam konteks ini kita katakan beginilah. Macam kalau kita mukhayyam, program kemah 3 hari 2 malam yang biasa di kalangan maknya sahaja, kalau di kalangan mereka bagi saya tidak ada masalah. Maknanya maknya jadi imam kepada maknya. Transgender jadi imam pada transgender, tak ada isu. Tapi kalau kata contohlah kami lelaki, kemudian ada maknya nak jadi imam, maka itu tidak wajar. Maknanya yang lebih baik adalah kita yang lelaki ini menjadi imam kepada mereka. Sebab mereka masih berpenampilan seperti perempuan. Tapi kalau dalam konteks sama mereka, tidak ada isu sepatutnya. Wallahu a'lam.
Baik, terima kasih kepada para hadirin yang mengajukan soalan. Masih ada soalan lagi? Kita ada lebih kurang 5 minit untuk sesi seterusnya. Jika ada para hadirin yang ingin bertanyakan terus, boleh buka mikrofon dan kamera, bertanyakan kepada Dr. Muhammad Izwan. Ada? Okay, saya kirakan tak ada. Okey. Jadi jazakumullah khair kepada Dr. Muhammad Izwan atas kupasan berkenaan dengan hukum fiqh dan bagaimana kita berurusan berlandaskan ajaran Islam dan memberi sedikit pencerahan. Bukan sedikit lah, actually memang seluas-luasnya lah berdasarkan daripada sudut pandang Islam. Sebab kita mungkin jarang berhadapan dengan pesakit dan juga komuniti transgender, terutama di Kuantan. Ada tapi mungkin tak seramai seperti di area Lembah Kelang. Ini memberi satu ilmu lah kepada kami untuk menghadapi pada masa hadapan. Baik. Jadi tanpa membuang masa, sedikit peringatan kepada para hadirin. Jangan lupa untuk tandakan kehadiran anda, dan juga untuk doktor, kita akan bagi CPD point QR code di akhir sesi seminar nanti. Okey, insyaAllah tanpa membuang masa, kita pergi ke topik seterusnya. Saya ingin menjemput Prof. Madia, Dr. Haris Shah binti Abdul Hamid untuk mengupas tajuk Gender Dysphoria from Psychological Perspective, Effect and How to Overcome. Okay. Without further ado, I would like to invite Tafadhal mashkura, Prof.
Okay, Assalamualaikum warahmatullahi wabarakatuh. Saya dengar tak suara saya?
Jelas, Prof.
Jelas. Okey, bismillahirrahmanirrahim. Tadi macam terdengar nama saya Haris Shah binti. Saya bin.
Maaf, Prof. Sorry.
Okay, I will try to share in about half an hour or so about gender dysphoria in terms of the effects and how to overcome. This is the title that has been given to me, inshallah. And I think there are a lot of things that would be overlapping with what had been presented by the 3 previous speakers. So I will try to make connections with what has been presented, and actually one of my major motivation to accept the invitation to speak at this seminar is the presence of the presentation by Dr. Izwan about the Shariat regarding transgender. Yeah, and let me see, move my slide. Okay. I will start with this overview of mental health and mental illness, and it has been presented earlier by the first speaker that gender dysphoria is a form of mental illness. It is documented in DSM. So people with gender dysphoria is by definition would be on the left side of this quadrant. So they may be struggling or floundering depending on their mental health. And based on the case study presented, I think the first case that was presented, the lady did not feel any distress. So maybe she is, from the medical point of view, she is struggling because she has high mental illness, but high mental health. She is not stressed with her situation. But somebody who has gender dysphoria and is experiencing the distress, either psychological or emotional, then they would be floundering. And these are two situations where that we would like to avoid. Yeah, we want people or everybody to be in the high mental health and low mental illness side. So we should all be flourishing. Yeah, and flourishing is optimal wellness. Yeah, and some people might be ill but not flourishing, and some of the persons affected by gender dysphoria might be ill and struggling at the same time. Yeah, so these are the sort of the starting point for the discussion about the effect. And actually, I'm not really convinced about the word effect in this presentation, and I will explain later. But now I want to connect to what Prof had mentioned earlier about Maqasid Syariah. Yeah, we try to promote behavior. We want to encourage behaviors that are promoting mental health. Yeah, for example, having healthy doubts about religion, about matters related to religious ritual, for example, and healthy risk appetite, creativity, and problem solving, and so on. And at the same time, we want to reduce the risk of mental illness, because this mental illness may affect the religion, the practice of the religion, or the image of the religion, our life, our intellect, and so on. Yeah, and if we apply this framework to gender dysphoria, I think gender dysphoria may have negative consequences towards the mental health, and also related directly to the Maqasid Syariah. Yeah, and I think we have heard earlier how people with gender dysphoria may actually produce negative image towards religion. If a person with gender dysphoria adopts a homosexual lifestyle, then they are painting a negative view towards the religion, especially if they or some other people start to demand that the country or the nation endorse the lifestyle and also provide the support for them to continue with their lifestyle. Yeah, and people with gender dysphoria may also experience depressive mood, as has been presented by the first speaker, Dr. Karinisa. And studies also show that they are also prone to anxiety more than people with who are comfortable with their gender. And in terms of intellect, they may also be experiencing cognitive stress. There are some examples that I will share later. And in terms of wealth, people with gender dysphoria may have to fork out money for expenses that are not necessary for people without gender dysphoria. And of course, in terms of the lineage, people with gender dysphoria may or may not have positive and also reproductive relationships. Yeah. So in this study, there are suggestions or recommendations for medical interventions for gender confirmation through through hormone treatment and also genital surgery. And it was found that the trans people present with higher level of psychotropic post-CGMI than cis-controlled. this is not cis, yeah, cis control. Cis refers to people who identify in terms of the gender that they were assigned at birth. Yeah, I don't really like this term, but in this case, we need to differentiate the trans people with the cis individuals. Yeah, so in this study, it shows that, or it gives the evidence that even after the intervention, trans people may have higher levels of psychiatric disorder. So hormone treatment and genital surgery may not really be helpful. And maybe this is perhaps another argument to support what Prof. Samsul talked about earlier. Yeah, and then people who have transition, either male transition to female or female transition to male, there were people who detransition, and among the reasons for detransitioning includes experiencing discrimination. Yeah, and I think that was sort of like a very interesting story circulating on social media about how one woman, this is actually not related to gender identity or gender disorder. One woman feel that a man has privileges in life. Man has more advantages. Man finds life easier compared to females. So she did an experiment and she tried to live as a man for, I think, maybe about a few months. And after she completed this experiment, I think she may not even have completed the experiment thoroughly. Yeah, she found out that she is depressed because she finds that being a man is very challenging. Yeah, so this is perhaps analogous to people who transition from one gender to another. They thought that the pasture is sort of greener on the other side, but when they transition, they found out that there are problems, there are challenges. And in this study, they said, the authors mentioned that people do experience discrimination, and then they found out that they are actually more comfortable identifying as their sex at birth. So they sort of the post-operation regret or the discomfort after transitioning. Yeah, and then they come to the view that the gender dysphoria was caused by something specific, such as trauma, abuse, or mental health condition. So it's not about being in a specific gender, it's about something else. So the treatment for that is focused on gender confirmation is not really helpful for about almost 40% of the people in this study. I'm presenting this the highlights from this study. Actually, I just want to reflect on what do we mean by effect of gender dysphoria. Yeah, what is the effect? Because when I read the literature, we talk about what is gender dysphoria. So gender dysphoria is involve distress. So we cannot say that distress is the effect of gender dysphoria. Yeah, it is part of gender dysphoria itself. Yeah, so when we talk about effect, I'm not really sure what could we mean by that, and also what would be the importance of looking at the effect of gender dysphoria. But I think that there are some of the research finding that we can take as the starting point, and then explore further to really look at to really understand the effects or the consequences of gender dysphoria. Yeah, I think as the statistics here show, some of the or half of the patient felt that they did not receive adequate evaluation from a doctor or mental health professional before starting the transition. So they did not make the decision with enough information, or the decision is poorly made, if I may use that adjective. Yeah, And I think if we take into consideration the spiritual advice, I think the figure would be even higher. I think people may not have had enough spiritual guidance to transition or not. Yeah, and some of the respondents even kept as a secret that they have transitioned into a different gender. Yeah, so when we talk about people transitioning, that is not necessarily a solution for many of those involved. Yeah, because there were cases of detransitioning and they found out the reasons for getting back to their original gender. And among those among those living with gender dysphoria, the frequent triggers include the body, fear of physical appearance, social, and also interpersonal experiences. And this trigger triggers results in anxiety or negative thoughts, such as thinking about self-harm, and also negative emotion like anger, sadness, and also fear. And I think this is important to understand what can trigger these episodes of anxiety, so that people can overcome the dysphoria, overcome the distress. People need to identify what could be the trigger. Yeah, I'm not talking about the treatment here. I'm talking about people who are living with gender dysphoria. How can they manage that discomfort? So the main point here is they need to identify their trigger. Yeah, and also how they react emotionally and also cognitively. Yeah, if they are able to understand their emotional reactions and their cognitive reactions, then perhaps they can discuss productively with their counselors or with their chaplain or spiritual guidance, about how to manage these reactions. And based on this qualitative study, people use different strategies. Some are perhaps constructive, some coping strategies are less so. So for overcoming gender dysphoria, perhaps we can look at what are the beneficial coping strategies. These studies on its own doesn't really evaluate whether one coping strategy is better than the other. I think this is important to highlight. When we talk about gender dysphoria, science can only tell us so much. Even the etiology or the causes of dysphoria is not clearly understood, and the treatment may have different levels of quality of evidence. And the politics around gender dysphoria is also very strong. So we need to make a clear stand, and before we take a clear stand, we need to be very clear about the issue itself. And something that is found in studies among Taiwanese university students. By the way, they found out that there are more female affected by gender dysphoria than males in this sample. In this Taiwanese sample. So both male and female, however, perceive significantly less support from their family. So based on this finding, what does it mean to strategies to overcome dysphoria? I'm not really sure whether it can be overcome, but I think we can minimize the effects of gender dysphoria. So family support is very important. And I think if you look at adults living with gender dysphoria, they have distress due to the contradictory gender that they were assigned and that they experience themselves. And then the interface of assigned gender identity and society. And I think this is the second point is the motivation for my question to Dr. Izwan. How do society interact with people who are transgenders? Yeah, and then the social consequences of gender identity. And I think this has been discussed in depth by Prof. Samsul, and also the internal processing of rejection and transphobia. People perhaps are not being kind enough to themselves. Yeah, I'm not saying that they should accept everything that is happening to them. Yeah, but I think they need guidance and they need help about how to think about themselves, and also the stigma, self-stigma, and also stigma from other people. And this is the sort of recent data that I've collected. I examined perception towards Sharia related to transgender. Yeah, and I think I'm very thankful. Syukur, Alhamdulillah, I've got to listen to the presentation from Dr. Izwan. I learned something new about the Sharia regarding transgender, and I wanted to measure elements. Perception towards the Sharia, not perception towards transgender itself, but how people perceive the Sharia regarding transgender. Yeah, because some people may be highly positive, they embrace the Sharia wholeheartedly, but some people may have doubts, and some people may reject the Sharia altogether. Yeah, as Prof. Shamsul mentioned earlier, when an ustaz says something against homosexuality, some people get offended. But what the Ustad mentioned is something related to the Sharia, yeah, something based on the Sharia. So I wanted to measure the different elements of perception, like knowledge. How much knowledge do people have about the Sharia regarding transgender? How much do they understand? How much do they desire to learn more about the Sharia? And how much are they confident to apply? Yeah, and also what is their tendency to share and discuss the Sharia with other people? Yeah, so I use a self-developed items based on an exploratory study. Based on the exploratory study, I tentatively validate the elements of perception, the KUDCT. Yeah, I found that they are useful to be measured. Yeah, so I developed 3 items each. I wrote 3 items each for each element, and I created an online survey open to all Malaysians above 18 years old. Or Muslim Malaysians above 18 years old. So the example of the questionnaire as in the picture. If you cannot read the screen, one of the question is, saya tahu pendapat para ulama tentang transgender. I know the ulama's opinion regarding transgender. Saya faham fatwa berkenaan perlakuan berkaitan transgender. I understand the fatwa regarding the behavior related to transgender. Yeah. So I alhamdulillah managed to get 104 respondents. In terms of the measurements, it seems that there are more than 2 dimensions. So I need to, but it has good reliability and good function of the rating scale. There are some issues regarding the person. Some persons may need to be excluded from this analysis. But the gist is perhaps I need to revisit the measurement model to make the instrument a clear unidimensional measure, yeah, so that I can confidently make conclusions about the levels of perception toward the Sharia, whether people have positive perception or negative perceptions. Yeah. And based on the available results, I can make some tentative interpretations. A lot of the items are actually quite easy to endorse, and some people have maximum marks, meaning I cannot go even higher. So maybe this is the real fact. Most of the or all of the respondents in this study do have positive outlook towards the Sharia, yeah. Or it could be because people have high social visibility. People want to appear Islamic or in support of the Sharia, or maybe the items themselves are simply too easy. I need to create more difficult items. Yeah, and if we look at the little graph down here, the lower the position of the item, the lower is the score. Yeah, so the desire to learn, 3 items for the desire to learn are the lowest. And from Islamic point or from the da'wah, sorry, not from the from tarbiyah point of view, I think this is quite interesting. Why do people rate desire to learn as the lowest element? Is it because they think they know enough, or they think it is not relevant to them? Do they not have the desire to learn because they think Sharia related to surgery doesn't really apply to them? Yeah. So I think this needs further investigation. And another thing is that I would like to explore even more is what differentiate the respondent who have high and low level of perception towards the Sharia. Yeah. So basically, I think I'll finish soon. Yeah. To mitigate the effects of gender dysphoria, how to overcome gender dysphoria, I think we need social and professional support. The individuals must recognize that they need help, and they need help from both the people around them and also people who have the expertise. So the program like the Mukhayyam, I think is a very good program to provide the both social and professional support at the same time. Yeah, and this could lead to positive changes in the people's life. And secondly, acceptance and comfortable expression of gender identity. And by this, I mean people need to accept their situations. In psychology, in humanistic psychology, we talk about the ideal self and the real self. Some people may need help to align their ideal self and their ideal self and their real self. Yeah. So if there are a gap between the two self, it can create discomfort, can make people experience problems in their personality development and also psychological development. And people with gender dysphoria also need help to find comfortable expression of their gender identity. Yeah, and I think with regard to Muslims, Muslims would recognize the difference between Muslims would be able to recognize the feeling of guilt. Yeah, rasa bersalah. Yeah, because there are clear rules regarding halal and haram. So when some person did something that is haram, then they would feel guilt. So how can people live with this guilt? Of course, one way is taubat, solat, zikir, and so on. But in the different areas of life, people with gender dysphoria need to find comfortable expression, how to balance between doing what is comfortable to them, that they feel natural, and what Islam says, what the Sharia says about what they should do and what they should not do. Yeah, and I think psychoeducation is also very important, and my intention here is to say that psychoeducation is for people with gender dysphoria and also the people, the general public. Yeah, we don't talk about whether homosexuality is a disorder. We now focus more on gender dysphoria as a disorder, because dysphoria or the discomfort is what make it pathological. Yeah, people need help in terms of their emotional and psychological distress. Yeah, so we need the psychoeducation programs to help people deal with gender dysphoria as a disorder, and also perhaps to increase awareness of psychodiversity. And again, I cannot express enough syukur, alhamdulillah, that Dr. Izwan has shared the finding from the research. And I think we need to show the diversity, the psychodiversity of people around us. Yeah, even mukhanaf can be divided into two categories. For example, this is something new for me. Yeah. So once we are more aware of the psychodiversity, then we perhaps would be more I'm not saying for lack of a better word, tolerant, yeah, and also acceptance and also respectful of peoples with different experiences, different backgrounds, and different situations in life. Yeah, those that are haram, we would still need to say as haram, but in terms of the persons, yeah, if we are more aware of the psychodiversity among the individuals, among people, then perhaps we can be more respectful and interact with those with different members of society in a respectful and compassionate manner. And I think my question to Dr. Izwan earlier about how people interact, how people should interact with transgenders, yeah, I think it's quite ironic. Yeah, people talk about, oh, Malaysia is an oppressive society. Malaysia criminalized homosexuality. Malaysia criminalized transgenders, and transgenders are discriminated against, and so on. But at the same time, Malaysia also openly support expressions of transgender. Malaysia support the expression of support men who dresses as a woman, either in movies or in comedy, in Maharaja Lawak, for example, and also on personal social media account. So I'm not really sure people are doing the right things, yeah, whether they are aware of the actual situations those people are experiencing, and perhaps what some people are doing is supporting those who doesn't need to be supported and not supporting those that need the support. So I guess the presentation, my presentation today, and also the presentation from the other three presenters would help us to differentiate between what is haq and also what is batil, what is good, what is not good, what should or what should deserve support and what should not deserve support. So with that, I thank I thank the organizer very much. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Jazakallah khair kepada Prof. Dr. Harish Shah atas kupasan for your explanation in regards to the topics of gender dysphoria from the psychological perspective. I have so far we don't have a question in text box, but there's one question from YouTube actually, because we are live streaming from YouTube as well. But this one is it's open to all the panelists to answer. What is dia lambat masuk. So basically soalan dia macam ni. Soalan dia berbunyi, kalau nak tanya apa definisi dan contoh gender dysphoria ini sebenarnya. Kalau ada contoh in real life lagi baik. Pastinya yang ni mungkin Prof ataupun Ustaz boleh jawab.
Okay, kalau saya I would repeat what Dr. Khairunisa had mentioned earlier. Yeah, yes, dysphoria means feeling of distress or discomfort, and when we pair it with gender, it means it means somebody who is experiencing discomfort regarding their gender. So they may feel that their current gender, the assigned gender at birth, is not the real gender. So they think that they should be and they should express their gender differently. So the example that Dr. Khairunisa shared earlier, somebody who is born as a female think that she is better as a male. Yeah, so that's a real life example.
Right. Thank you, Prof. Just to pick on the one of the points that you said earlier, that female experience more distress with gender dysphoria, but somehow in our society it's more acceptable for female to wear male clothing compared to the other way around? Could you elaborate more why they have more female have more experience while the society accepts that female to wear male clothing to appear more masculine in our society?
Yeah. I think this is related to the point in one of the slides, the interface between gender identity and social environment. Yeah. So I think our social-cultural values would perhaps affect or shape how we accept the expressions of gender among members in the society. Yeah. So for example, men in our society are expected to wear kain pelikat. However, in some states or in some kampung, it's very common for men to wear kain batik. Yeah. So it depends on the localities. It depends on the situation. So if in KL, men go to Masjid Negara wearing kain batik, I think people would be raising eyebrows. Yeah. But if this happens in, I don't know, I'm trying to avoid being stereotypical, yeah. But in some districts or in some kampung, men wearing kain batik is normal. Yeah, and the same with female wearing male clothing. It depends on the norms of the society. Yeah, so if it is accepted as a norms, I think it is not considered as problematic. Yeah, and normalization is normalization happens naturally through social influences, and I think what I'm worried about is if people, some group of people are actively trying to modify the norms to suit their agenda. Yeah. So if they want to change the current norm by using political correctness or wokeness or some other approaches just to make sure that their agenda are accepted by the mainstream, I think that's something that we have to be vigilant. Something that we have to say something about.
Right, thank you, Prof. As of now, I open the question to the attendees. If you have any question, you can open your microphone or you can type in the chat box. As of now, we only have one question just now that I already forwarded. Anyone from the audience? Okay.
Boleh saya tanya satu lagi soalan kepada Dr. Izwan?
Ya, Dr. Izwan. Dr. Izwan masih ada di sini?
Ada tak Dr. Izwan?
Rasanya
dah tak ada.
File dah tak ada.
Oh, dah tak lah. Di apa kemudian lah.
Rasanya kalau if let's say we don't have any more further question, I would like to thanks to Prof. Haris Shah for our explanation for the topics for gender dysphoria from psychological perspective, and we are enlightened with this point that you presented with the research points and also the research evidence, and I think without further ado we can go to with the conclusion for today's seminar. Alright, baik. Kalau ada apa-apa yang Prof. Haris nak tambah dan juga daripada Prof. Samsul untuk tambah daripada saya punya rumusan, saya silakan. So daripada topik yang pertama berkenaan dengan gender dysphoria from medical perspective, kita melihat seperti yang Prof. Haris dah sebutkan tadi tu, the definition of the gender dysphoria itself. Okay, they have a distress in this unsatisfaction in their gender identity. So apabila someone come to you with the gender dysphoria, don't forget to differential diagnosis with the DSD. Don't forget to do the physical examination and to involve other teams as well, which is also important before we proceed with the treatments, which each of the conditions have different treatments. Okay, maksudnya untuk DSD, the treatments could be for maybe at some point they need a gender reassignment surgery or hormonal therapy. And also for true dysphoria, they probably need a psychotherapy and also counseling, which is such as mentioned earlier by Prof. Samsudraman, conversion therapy or spiritual therapy. And also for our second session, dari sudut pandang sosial in Malaysia, it is not accepted in Malaysia basically, which is it's punishable up to 20 years of imprisonment. And the root cause is the main topics that we need to tackle, which is the desire. Memang kesan daripada gender dysphoria ini memberi kesan tersebarnya penyakit berjangkit dan memberi impak yang lebih besar kepada negara seperti kewangan dalam rawatan dan penjagaan PrEP, sebagai contoh PrEP kepada golongan MSM dan juga untuk monitoring. And this lead to another issue such as the less use of condom, which lead to another issue, which is like dominoes effect, lead to another increased case of STI. And basically, yes, we have CPG guidelines, but despite that, Al-Quran dan As-Sunnah must come first demi kita menjaga maqasid syariah di Malaysia, ya. Okay, dari sudut pandang Islam, daripada Dr. Izwan punya topik, dia adalah basically kita ada beberapa golongan, iaitu ghair khalqi, dan ghair khalqi ni adalah yang transgender lah, yang lelaki yang berperwatakan sebagai perempuan dengan sengaja. Walaupun dalam hadis Nabi mengatakan mereka adalah golongan yang dilaknat, usaha-usaha dakwah masih perlu dilakukan. Dari segi hukum fiqh, dari segi kita berurusan, kita masih perlu appreciate them seperti gender yang asal, jangan lupa tu, dan jangan lupa juga dengan batas-batas untuk mengelakkan fitnah. Dan dalam segi tu kita jangan lupa untuk berdakwah kepada mereka. Dan juga kepada topik yang disampaikan oleh Prof. Haris, dari sudut pandang psychological, efek memberi kesan basically kesan kepada individuals, okay? Mereka senang untuk mendapat distress, dan untuk mitigate dia melibatkan individu, keluarga dan juga masyarakat. Okay. Ada apa-apa tambahan daripada Prof ataupun daripada Prof Samsudraman, dari Prof Haris?
Tak ada daripada saya.
Tak ada, okay, alright. Alright, so kita ada baik, untuk para hadirin, our doctors, you can scan the QR code for your CPD points over here, right? And later we'll submit the link for the feedback form. All right, so we leave it to the link. If feedback form is in our chat box, and also the QR attendance for our CPD points is in the screen. You can scan now. Okay, I would like to thank everyone for the involvement to participate in this seminar for today, which is quite overwhelmed. I'm impressed with the numbers of participants for our seminar today. And before we actually disperse, I would like to take a picture. Boleh? Kita buka kamera, kita ambil gambar. Boleh tak? Untuk participant semua. Okey, baik. Kita dah ambil gambar. Sorry, saya tak sempat nak kira 1, 2, 3 sebab organizer dah snap the pictures. Okay, thank you so much for your participation. Jangan lupa isi feedback form to get your CTD points and also your CPD points. Tanpa buang masa, kita tangguh dulu dengan bacaan tasbih kafarah dan surah Al-As. Assalamualaikum warahmatullahi wabarakatuh.